I would encourage our colleagues to come in and vote and depart the chamber so we don't have gaggles of conversation here on the floor. That's particularly important for our staff here in the front of the chamber. So I would encourage everyone to take full advantage of a full 30-minute roll call vote, come in and vote and leave. And be aware of the social distancing that Dr. Monahan and others have recommended as we come over to the chamber and as we depart. With that, I think we'll be able to get through the voting that will occur in all likelihood later today without violating any of the safety precautions that have been recommended to us by the Capitol physician and others.
Under the previous order, the leadership time is reserved. Under the previous order, the Senate will be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
I suggest the absence of quorum.
The clerk will call the roll.
Mr. Alexander.
Madam President,
The Assistant Democrat Leader.
I ask consent the quorum call be suspended.
Without objection.
Madam President, I come to the floor this morning with sad news. Illinois has lost its first resident to the coronavirus pandemic, which is threatening our country and the world. Her name was Patricia Friesen, 61 years old, a retired nurse. She was an exceptional person, and her brother said she cared for everyone but herself. She lived taking care of people, and she loved it. She started having breathing difficulties last week and was hospitalized at one of our better hospitals in the city of Chicago and succumbed yesterday to the coronavirus and its complications. She had had a history of respiratory illness, but she was taking care of herself and staying home as she was told to do. The family remembers the last time she left the house was 2 weeks ago to attend the funeral of a friend. She did entertain visitors at her home from time to time. Her two sisters have asked for tests themselves because they were in contact with her, and I'm sorry to report they've been unable to obtain those tests, at least as of late last night. I've spoken to the governor of Illinois almost every day, and we are having, through the state laboratories, about 350 tests each day. This state of almost 13 million people. In addition to the state lab test, other private labs and hospital tests account for a number comparable but not much larger than 350. There just aren't enough tests, Madam President, and I'm sure our plight is not unusual. We've heard a lot about the tests on the horizon coming soon. The sooner the better. And until we get into more complete testing, it's going to be difficult for us to measure the extent of the infection and the impact. It's almost impossible to target areas of our state that need more attention than others because of the lack of testing. We had a nursing home over the weekend where there was a patient who tested positive for the coronavirus, and the Department of Public Health, the state of Illinois, went to that nursing home in Willowbrook, and as a consequence of the first test, tested all of the residents and staff and found 22 testing positive for the coronavirus infection. Naturally, that raised our numbers dramatically. We now have 160 known cases in our state in 15 different counties. But it's an indication where there is a signal of infection that testing is absolutely essential so we can identify all of those who may test positive. Patricia Friesen's brother, Richard, was asked what he thought about the news that she was the first fatality in our state. He said it was heartbreaking, but then he said, I tell everybody, take this very seriously, as we should. I think across the United States, we're coming to realize that this is an exceptional public health crisis and challenge, the likes of which we've never seen. Sometime later this morning or early this afternoon, we will consider the package that was passed by the House of Representatives in the early morning hours of Saturday. It's a package which was designed to provide some help, some financial assistance to workers and families across the United States who are coping with either the illness or losing their jobs or being laid off because of the state of the economy. We feel on the Democratic side, and I believe that feeling will be shared on the Republican side, that one of the first things we need to do is to assure those employees who may not feel well that it's best to stay home. And there's a way to do that without sacrificing the basics in life, your home, your food, and what your family counts on. So we put together this package with the White House on a bipartisan basis that provides family leave and medical leave. It also provides extension of unemployment benefits that are necessary for many workers across this country. Passing this bill this morning or this afternoon is an important step forward to let the people across America know we're doing what we can here in the Senate and in the House to be responsive. Senator McConnell came to the floor this morning and announced the next bill, Coronavirus 3, if you wish, which is a much larger undertaking, and it will embark on trying to get the economy on its feet enough to sustain what we are facing with layoffs and business closures. It is a daunting task. The amount of money involved is anywhere from $700 billion to $1 trillion. I've heard these estimates from time to time, and that is a massive amount of money by any measure, but when measured against the economy of the United States may not be adequate to the challenge. Some have suggested cash payments to individual Americans. I have no aversion to that idea, but I hope it is substantial, and I hope it isn't a one-time helping hand that isn't followed up. Many of us on the Democratic side are working on a program that we think will say to families, we're not just going to send you one check and wish you the best. We're going to stand by you through this very difficult and challenging time. I've spent the last several days on the telephone with business leaders across our state. It started with calling one of my favorite restaurants that sent an online message about closing down for business and not quite sure of their future. And it is troubling to hear a person, a family member who has put their lives into a restaurant, put their life into a restaurant, now facing closure and wondering if they'll ever open again. Some of us are buying gift certificates at our favorite restaurants to help them get through this and help their employees during this period of time. My wife is doing it in Springfield. I've done it in Chicago. We'll probably do it more, and I encourage others who want to make sure that restaurant is there when we've weathered this storm to extend a helping hand if we can. Some of these restaurants are teaming up with charitable organizations to produce the meals that are needed for school children and their families. It's a little different assignment, but these restaurants are the best in their profession, and it's great to see them cooperating and working together. I might also add that the Democrats have a proposal which Senator Schumer has spelled out and will undoubtedly speak to again when he comes to the floor this morning. So we have, at this moment, at least two tracks, two paths toward the third bill to try to help the economy. Senator McConnell has suggested that he will do his exclusively among Republicans, and that may be a necessary starting point, but I urge him and all of the leaders to come together on a bipartisan basis as quickly as possible. The first two measures that we have passed, the initial $8 billion supplemental appropriation for the healthcare side of the equation, was essential and done quickly on a bipartisan basis. The second measure, which I hope we pass today in the Senate, was also done with the White House, Speaker Pelosi, Democrats, and Republicans working together. Each of us had to give. This measure we're voting for is not what I would have drawn up, and I'm sure Republicans feel the same, but it is a compromise and one that we ought to move forward on. The third measure we're considering should be nothing less. It ought to be bipartisan from the start. Senator Schumer, at a press conference yesterday, suggested that the four leaders of the House and Senate, Democrats and Republicans, meet with the White House and sit down at the table now to get started on putting together this measure, rather than to retire to our sidelines and each work individually or separately. The sooner we come together, the better. One of the provisions that Senator Schumer insists on, and I would add my voice in chorus, is that we be sensitive to the reality of the healthcare facilities across America and what they're likely to face in the weeks to come. Hospitals and frontline responders are telling us that they're worried that they lack the equipment and resources that we need. Some experts predict that as many as 1.9 million intensive care unit admissions from this outbreak will take place over the next several months, swamping existing facilities. There are only 100,000 ICU beds across the entire United States, and accommodating 1.9 million, we know will just overwhelm the system. There's also a major dearth of necessary masks, respirators, ventilators, gowns, goggles, all of the things that are essential to protect healthcare workers and to save the lives of those who are facing this illness. What a frustration it is in my state, the state of Illinois, that I still get reports from virtually every level that the so-called national stockpile has not opened up its doors for my state when it comes to basic needs. I mentioned earlier about a nursing home with 22 positive infections in my state. The head of the Illinois Department of Public Health who alerted me to this told me that they were going to, in a very short period of time, use up the protective equipment and masks and gloves, for example, that they had available. They didn't know where to turn for more. Let's get this together. I believe there is a national stockpile, and I believe it should be open for the states that need it immediately, and our state is one of those. These ventilators and breathing devices, the president in a press conference a couple days ago said the governors should do their best. We can do better than that. The largest stockpile of this equipment is in the possession of the federal government, and we should turn to it quickly to help those in need. I'm very concerned as well, and I'll close. I see my other colleagues on the floor, and I know they would like to make comments as well. I will close also by saying that I think as we undertake the next piece of legislation, the 800, 900, 1 billion or trillion-dollar bill, I hope the first priority is to make sure that we help our hospitals. I have a measure with Senator Lankford, Republican of Oklahoma, that will compensate hospitals in rural areas and downstate areas in Illinois. I'm fearful that they'll be the first to be overwhelmed. And I hope that those of us representing rural states will come together and join, as Senator Lankford and I have, to try to find a way to make sure they are adequately funded to get through this crisis. I might also add that we also need medical professionals in the long term, and I hope that we'll dedicate ourselves to improving the National Health Service Corps as one way of doing that and focusing that in rural areas. Finally, I have a bill with Senator Alexander, Senator Murray, and Senator Blunt to take through the National Academy of Sciences a survey of our dependence on foreign-made medicines and medical supplies and medical equipment so that we can establish, not only during this challenge and crisis, but for future challenges and crisis, whether we have adequate domestic production capacity or necessary stockpiles to protect us. We found, for example, that some 20 major drugs were manufactured exclusively in China. And as China went through the early stages of this coronavirus crisis, there was a fear that we'd be cut off from sources. So we've asked the National Academy of Science to give us a survey as quickly as possible. I'll close by saying that it is interesting as I follow the emails of my friends and family and hear from my colleagues that as we are separated with this social distance, which we are trying to respect across the United States, as we are separated, it is interesting how much we are drawn together. Our families' emails and phone calls have been more numerous than ever as we think about one another more and reach out as we hear that there's a need within our family. There is more conversation and candor than I can ever recall in our family conversations. Perhaps adversity is creating community. Perhaps this situation, this concern that we have is leading to more empathy. We're going to get through this. America always does. There'll be some painful moments, some very difficult ones. And I think those who have sent us to do this job in Washington expect us to put our party labels at the door, find solutions to the challenges we face, help our nation through this crisis, and come out strong on the other side. Madam President, I yield the floor.
Madam President,
The Democratic leader is recognized.
and I thank my good friend from South Dakota for his usual display of patience. Now, the coronavirus pandemic continues to test our nation in new and difficult ways. There's now a confirmed case of coronavirus in all 50 states and the District of Columbia. Our public health system was understaffed and under-resourced, and without intervention, it could soon become overwhelmed. Even as the market shifts from day to day, the coronavirus is slowing our economy to a near standstill, and we're almost certainly anticipating a recession. You go to the streets of many cities, towns, and villages. They're empty. Schools are closed in large portions of the country, and businesses are struggling not to lay off workers because they don't have customers, they don't have clients, they don't have income. So there's a great urgency here, and there are really two separate and simultaneous emergencies, one in our healthcare system and another in the economy. We have to deal with both, and if we don't solve the one in our healthcare, the economy will continue to get bad no matter what we do for it. Less tangible than those two emergencies, but still very real, is the impact the virus is having on American society. My home city of New York is effectively on lockdown. You can go to a place like Times Square Station, subway station, and see nobody, actually nobody there. Americans are being asked rightly not to gather in groups of 10 or more, not to go to dinner or to a bar or to their church or place of worship. Now, Madam President, I have lived through 9/11. It occurred in my city. I knew people who were lost. I lived through the days of the financial crisis in 2008 and other moments of national urgency. But there's something much worse about this crisis we face. I have never sensed a greater sense of uncertainty, a greater fear of the future, of the unknown. We don't know how long this crisis will last. You don't even know if you've contracted the virus right away, or maybe your spouse, maybe your child, maybe your parent, maybe your friend. And then there's a much greater sense of isolation, a problem for which there is no cure. I miss not meeting and talking to my constituents. They're our lifeblood. Well, that's not just happening to us here in the Senate. It's happening across America, friends who used to get together, families that had gatherings. Different social activities are gone. Book clubs, card games. The fabric and sinew of our lives as human beings has been put on hold, and nobody knows for how long. By necessity, Americans are now sacrificing their normal lives and daily routines, and maybe worst of all, sacrificing a sense of community, because we all, each individually and together as a country, must fight this awful virus. And unfortunately, we're only just beginning to see the necessary seriousness and mobilization of resources from the federal government. Sadly, unfortunately, and with awful consequences, this administration took far too long to wake up to this global crisis, wasting precious weeks downplaying the severity of the coronavirus that could have been spent in earnest preparation, building our test capacity. As a result, the United States continues to lag behind other countries in the number and the percentage of the population we are testing. Stories of Americans who feel sick and are showing symptoms but are unable to access a coronavirus test appear every day in every single newspaper. Warnings of a potential shortage of masks, hospital beds, and ventilators appear in the paper every day. In 2 weeks, the issue of ventilators and ICU beds will be like the issue of tests today. In other words, 2-3 weeks ago, many of us were saying, get those tests out. A month ago, people were saying it, and now we're seeing the consequences. Lockdowns, because we can't test people. We don't know who has the virus and who doesn't. Well, the same crisis will be occurring in a few weeks. Mark our words, unfortunately, it's true, about ventilators and ICU beds. We're behind the 8 ball on tests, and we're soon going to be behind the 8 ball on ICU beds and ventilators as more and more people get sick. The administration didn't pay attention to tests, and now we're paying the price, even though many of us were hollering for weeks about the emerging issues with testing. Well, the same problem's about to happen with ventilators. We know that in 2 weeks, the number of ventilators might become a massive problem. We must get ahead of it, and get ahead of it now. I'm calling on President Trump to use his existing authority to help address the widespread shortages of medical equipment, particularly ventilators, as a result of the COVID-19 outbreak. I joined 27 of my colleagues in a letter to President Trump urging him to invoke the Defense Production Act of 1950, which authorizes the President to strengthen domestic manufacturing capacity and supply in extraordinary circumstances. It's used in times of war. Well, we must mobilize as if it were a time of war when it comes to hospitals, beds, supplies, equipment. And the DPA, the Defense Production Act, allows the President to direct the production of private sector firms of critical manufactured goods to meet urgent national security needs. The President should do so immediately. Today, a report came out that the Army Corps of Engineers and FEMA are ready to and willing to participate in the response process. The Army Corps could build temporary hospitals with beds. But they still haven't received instructions from the White House, from the administration. I thank the men and women willing to be on the front lines combating the pandemic. But this kind of inexcusable action is maddening, infuriating, and must be rectified. Lives are at stake. Public health infrastructure is the top priority, because if we can curb this virus, the economy will get better. We need to do things to help it, obviously. But if you ignore the public health crisis with the equipment and infrastructure and personnel that is needed in many more numbers than we've ever seen, the economy won't get better. So, the legislation passed by the House on Saturday, phase 2 of the coronavirus response, is a little bit of this, and that must pass the Senate today. But unfortunately, first we must dispose of a Republican amendment that would make a condition of the bill a requirement for the President to terminate military operations in Afghanistan. Yes, you heard me right. Our Republican leadership has put on the floor an amendment that would make a condition of the bill a requirement that the President terminate military operations in Afghanistan. In a time of national emergency, this Republican amendment is ridiculous, a colossal waste of time. We probably could have voted on this bill a day or two ago if not for the need to schedule this amendment. I'm eager, we are all eager, to dispatch this absurd Republican amendment and send this bill to the President. It allows, for instance, for free testing and treatment in coronavirus, very much needed. We can send this bill to the President and begin work on the next phase, phase 3. Now, as my colleagues know, Senate Democrats have already outlined several proposals for the next phase of legislation, and the specifics have been made public. The proposal has 4 main priorities: public health capacity, unemployment insurance, paid sick leave, and priority treatment for labor in any bailout to industry. There are many things in this bill that are important: paid student free, no payment on student loans or mortgages, help with our mass transit systems. There are many things, and Democrats are going to fight for them in the next phase of the response. But the priorities I mentioned are key: public health capacity, unemployment insurance and paid sick leave, and priority treatment for labor and any bailout to industry. On the public health capacity, as I mentioned, we need masks, we need hospital beds, we need ventilators, we still need testing kits. And so, Democrats are proposing a Marshall Plan for our public health infrastructure. The sooner we act on it, the better. We also need to help, in terms of our health care system, public transportation. Tens of thousands of healthcare workers in New York City and many other cities cannot get to their jobs, their very needed jobs, if there's no public and mass transit. But a Marshall Plan for our public health infrastructure is what is needed now. And it will prevent the situation from getting even worse, and it will allow our ailing economy to begin to heal once we contain this virus. Workers who get laid off or have their hours expanded or have their hours cut to almost nothing need expanded unemployment insurance, period. Yesterday, the Secretary of Treasury reportedly told Republican senators that unemployment could hit 20%. Unemployment insurance is a non-negotiable part of our response to the coronavirus. And paid sick leave. Senators Murray and Gillibrand have a paid sick leave policy to meet this crisis. It should be added to this part of the legislation. I think they will ask a unanimous consent request or offer an amendment to do so. If it's not included in this part, it should certainly be included in the next phase of legislation. Now, there will be other items that we have to address down the road. Certainly, certain industries are struggling, airlines, hotels, but we must make sure that we prioritize public health and workers over corporate bailouts. And if there's going to be a discussion about a bailout, it must include worker priorities and protections. The airlines are very important, for sure. They employ a lot of people. Many of us who fly back and forth to our states know what the good people who work as the pilots and the flight attendants and the mechanics and the clerks and the ticket takers. They're good, fine people. We want to make sure they're protected. And one of the reasons, let's not forget, that many airlines are so short of cash right now is they spent billions on stock buybacks. Money they had to send out when they should have been saving it for a rainy day for their workers and customers. That issue should be addressed. Now, a few of my Republican colleagues have proposed a one-time cash payment of $1,000. But my fellow Americans, this is not a time for small thinking. This is not a time for small measures. This is a time to be bold, to be aggressive. A single $1,000 check would help someone pay their landlord in March. But what happens after that? How do they pay their rent in April when their office or restaurant or store is still closed for business? How about May? How about June? The president suggests that this recession could last through the summer. $1,000 goes by pretty quickly if you're unemployed. In contrast, expanded unemployment insurance, beefed up unemployment insurance, covers you for a much longer time and would provide a much bigger safety net. This is time to put tribalism aside and acknowledge that this recession, if we allow it, would do real harm to Americans up and down the income scale, and it will hurt Americans of all ages. So, if we're going to provide direct payments, they need to be bigger, more frequent, more targeted. Millionaires shouldn't get them. Now, these are the kinds of issues that all parties are going to have to discuss. Democrats and Republicans, House and Senate, and the White House. The sooner we discuss them together, the quicker we'll be able to move forward. But Leader McConnell announced yesterday that his plan to develop the next phase of legislation would be first for Senate Republicans to sit among themselves and then sit down with the administration and come up with their own proposal before presenting it to Senate Democrats, let alone House Democrats. The process that Leader McConnell has outlined for Phase 3 legislation is too cumbersome, too partisan, and will take far too long, given the urgency and need for cooperation. Secretary Mnuchin says he wants legislation passed by the end of the week. The McConnell process will not get us there. Phase 3 legislation should be the product of a five corners negotiation: House and Senate leaders, majority and minority, plus the White House. That's the way that's worked the best, the quickest, the fairest in the past. If all parties are in the room from the get-go, the final product will be guaranteed swift passage. The process Leader McConnell outlines is far too reminiscent of the typical legislative process in the Congress, a process that far too often results in delay and gridlock. We can't afford that right now. Leader McConnell was right when he said that in times of national emergency, we must shed our partisanship and rise to the occasion. So let's begin that way. Republicans and Democrats, House and Senate, Congress and the White House. The best way to advance Phase 3 legislation is to have a five-cornered negotiation from the outset. I yield the floor.
The Republican whip.
Mr. President, here in the Senate, we are continuing to move forward with the next installment of coronavirus relief legislation. I expect later today we will pass the bill passed by the House earlier and looking beyond it to a third bill that would provide additional relief to the American people. And as the leader has said, we have three priorities: providing direct assistance to American workers and families, many of whose lives have been disrupted and dislocated in jobs, feeling a lot of economic harm, economic pain, giving our economy, especially our small businesses, the necessary support to weather this storm, and most importantly, providing medical professionals with the resources that they need to fight this virus. The House bill addresses these priorities to some degree, but it is not a comprehensive bill, and additional legislation is going to be needed. We especially need to ensure that the worker benefit requirements the House bill places on small businesses are accompanied by sufficient support. Small businesses are at the most risk economically during this time, and we need to ensure that they have the resources they need to get through this. I'm looking forward to continuing to work with my colleagues of both parties on the House bill and on additional legislation. This is a time for all of us to come together to ensure that medical professionals, American businesses, and American families have what they need to combat the coronavirus and deal with its effects. Mr. President, I can't think of a time where we saw schools and businesses closing on such a mass scale. It's a challenging time for our country, but if we pull together, we can get through this and come out even stronger. All of us have a role to play in combating this virus: washing our hands regularly and thoroughly, practicing social distancing, staying at home as much as possible, listening to advice from healthcare officials. All of these things are essential to flattening the curve in limiting the number of infected Americans. It's vital, Mr. President, that we keep as many people as possible from getting infected so that our hospitals and medical professionals are not overwhelmed with cases. Our medical professionals are putting their lives on the line every day to care for coronavirus patients. Let's make sure we do everything we can to keep the number of cases that they're dealing with as low as possible. Mr. President, in difficult times, Americans rise to the occasion, and I am confident that that's what we will do again. Mr. President, I yield the floor.
Mr. President,
Senator from Oregon.
Mr. President, as I walked outside across the Capitol grounds, it is such a beautiful day. The cherry blossom trees are blooming. There were mothers with young children, 3- and 4-year-old children, playing on the grass. And it seemed like just so idyllic, so perfect. It seemed like nothing could be wrong in America. But in fact, so much is wrong in America. Our everyday rhythm of life has been shattered. We're facing a medical pandemic and an economic collapse. K-12 schools closed. Universities shut down. Grocery stores empty. Restaurants locked. Gyms, movie theaters, music venues closed for business. And the reverberations of so many core businesses, core retail being shut, are affecting virtually every family and every small business across this country. So many forms of commerce grinding to a halt. The economy is imploding. And it's touching the workers, and it's touching those small businesses. Workers are experiencing the reality of reduced hours, lost shifts, layoffs, and they don't know when they're going to be able to pick up that work again. And then they're not sure how they're going to pay their utilities, and how are they going to pay their rent, and how are they going to pay their mortgage, and when will American economy start to heal, and will they be able to go back to work? So American people are anxious, worried rightly about the threat of the disease, and worried rightly about the collapse of the economy. Coronavirus is marching on America. As of yesterday, or actually as of this morning, we have almost 6,000 cases here in our United States of America, 5,881 cases as of this moment. Compare that to a week ago. We're talking about 1,200 cases a week ago. That's a 5-fold increase in a week. And we now have more than 50 states affected, or all the states, Puerto Rico, Guam, the U.S. Virgin Islands. And then we can ponder the fact that the number of deaths has gone up. 51 deaths compared to in the 30s a week ago. So the coronavirus is marching on America and marching on the economy. It's a double hammer affecting families and small business. And it is particularly appropriate this moment to share with all of you the stories of small businesses in my home state that are being impacted. More than 40 businesses sent in their stories, and I'm going to share 6 or 7 of those stories. But as we think about how we proceed, we need to recognize that this recovery needs to be one where we invest in the foundation up of our economy. We invest in the families. We invest with sick leave. We invest with unemployment insurance. We invest by covering the health costs of getting tests and the costs of getting treatment. And we invest in our small businesses. Not so long ago, we had a bailout that favored big business. And big business went on to make billions of dollars and then get a massive tax break in 2017. Right now, the airlines are asking for a $50 billion bailout, but they have spent almost $50 billion in stock buyouts over the last few years because they were so profitable. And why did they do stock buyouts? Because it increased the value of the stock options of the corporate executives in that industry. This is a version of private gain and public pain. When a business says, during the good times, I will keep all that money, thank you very much for not charging me any taxes to maintain our infrastructure, or our military, or our medical care system, and then when we hit a hard time, we will ask to be bailed out. So we will have conversations about that strategy for big business. How about instead we focus on the families, the pain they're feeling, focus on the small businesses and the challenges that they're facing. We need a Main Street recovery, not a Wall Street bailout. We need an economy rebuilt from the bottom up, not from Wall Street down. Small businesses like Margaritas, a small Mexican restaurant in Ontario, Oregon. It's a great place for people to gather for a meal, and unlike nearby fast food restaurants, they aren't known for their takeout. But to combat the virus, the state of Oregon has shut down sit-down restaurants and asked them to go to takeout only. Well, that's taking a toll on the Margaritas. When a couple came recently in the door and sat down for a meal, the restaurant staff had to explain that they could make their meal for them, but they would have to make it to go. And the couple got up and they didn't order to go, they walked out the door. And the owner of Margaritas notes that they are just struggling to keep their restaurant open, that business is not coming in enough to pay the workers. So if things don't pick up quickly, he's going to have to enclose and ask his employees to file for unemployment. Or how about the Paddington family of stores in Ashland, Oregon, in business since 1973? In recent years, they've endured all kinds of challenges, including a couple of summers in which wildfire smoke created a major challenges for the businesses in Ashland, Oregon. But things were looking pretty good this year. Business was doing okay. Now, however, the owner says that they, quote, felt their world crumble in March with the threat of the coronavirus changing our world. They've laid off 8 staff members just this week. That's 30% of their staff. In a single day, their sales dropped 50%. As things are going now, they'll need to lay off more staff within the next few weeks if the business climate does not change. And the story is much the same for the retailers throughout the town of Ashland, Oregon. The story is similar in Portland, where Betsy and Iya, a company that has designed and manufactured jewelry for the past 12 years and regularly employs about 17 workers, had to downsize. And so they had to ask 3 of their workers to be let go. This is a business that's gone out of its ways to promote other local businesses, but sales have dropped off very quickly. I would presume that in this sense of crisis, families are buying essentials, and that means those in the jewelry industry are seeing their sales drop. The sales have dropped very quickly. They're seeing the virus's huge economic impacts, and they are expecting to have to lay off more people soon, and they're looking for help. Ultra-zone laser tag. Now, you might think that with folks being out of work, they might go to a place to get some exercise, have some recreation, the sense of separation might be okay. Maybe laser tag would see an upsurge in sales. Not the case. Lee Sturman, Ultrazone Laser Tag in Milwaukee, says, "My name is Lee Sturman. I am the owner of Ultrazone Laser Tag, a family entertainment center located in Milwaukee, Oregon. As the founder, I have successfully operated for 26 years. During this time, like all small business owners, I've battled competitors and overcome other challenging obstacles. On a level playing field, I have managed to survive and thrive. But unfortunately, my business has been upended by an invasion of tiny microbes. COVID-19 has struck fast and struck hard. In a matter of 2 weeks, Ultrazone has gone from busy crowds to near emptiness." Steve and Christy Ball operate Basin Indoor Gardening in Klamath Falls, Oregon. And they note in response to the Klamath County Chamber of Commerce collecting stories of the financial impact COVID-19 is having on local businesses, they submit the following and appreciate the opportunity to share. And I appreciate the fact that they responded and are sharing. So Steve and Christy note, that they have owned a small retail business in downtown Klamath Falls for nearly 11 years. So I've experience with seasonal fluctuations and customer trends that affect the cash flow and overall revenues of the store. Things have been shockingly slow since the beginning of March, but especially this last week where customer traffic has almost halted. Based on last year's total for March and daily sales compared to this year's same time frame, my store gross sales are down to about 36% of normal, indicating 64% loss in revenues. I hope this is short-lived and business come back to what is normal. More than a month like this will force some difficult decisions for the future of my store. April Severson of Portland writes, I've owned my event production company for 20 years. My business has always had its ups and downs, but this is the first time I've had all of my contracts canceled. I'm the sole employee of my company. My canceled contracts have also canceled the work for my associates and vendors in audiovisual, entertainment, decor, furniture rentals, venues, floral, and catering. Since most of my vendors are small and emerging businesses as well, this has had a spiraling effect on our ability to pay our bills, insurance, and mortgages, and to take care of our families. Amy Baker is the owner of Threadbare Press in Eugene. And she notes, my screen printing business relies primarily on schools, restaurants, and events to keep our t-shirt presses running. On Friday, March 13th, as the stock market tanked and major cultural centers shut down across the country, I saw a third of our monthly revenue vanish in one day. In the 5 days since, my email inbox has remained empty as our client base struggles to shore up their expenses. I have laid off half of my 6 staff this week and have let the rest know that next week they will temporarily not have a job. It's hard to feel like so many people depend on me for their paychecks, let alone my own children that depend on me for their own livelihood. I've helped my staff apply for unemployment, but there is no unemployment for business owners. We are a small business that essentially lives week to week based on our clients. In a perfect world, there would be money to pay my staff, paid leave, or savings to sustain myself while we close our doors for what I estimate to be a month. However, we are not in that position. What I'm hoping for is to ride out this storm with forgiveness on my own bills and expenses that will not get paid next month. I'll need emergency, low-interest capital to get back to work and bring my staff back on. And then we have all of our state's music venues like Mississippi Studios, the historic Liberty Theater in Astoria, the Ashland Shakespeare Festival in Ashland, all of them in danger of going out of business. With social distancing, the prohibitions on large gatherings, and the sudden cancellation of musical acts, the venues are experiencing a sudden and total loss of income. So here we are. Those stories are representative of things just happening all over my state, and I know in every state of the United States of America. The economy is imploding, and with each and every small business that can't pay its bills, it affects other small businesses and other larger business. It affects those who have rental housing and those who have mortgages. All of us are going to be touched, and that is why it's going to be so important that we turn to this third stage of response by the U.S. Senate. The first stage was to shore up the healthcare industry. The second stage was some immediate help with sick leave and unemployment insurance and food assistance and free testing for the coronavirus. That bill inexplicably has been sitting untended in this chamber? Why aren't we all 100 here debating it before the American people and voting on it? I'm told that now maybe, possibly, the bill will come to the floor this afternoon, that some deal will be worked out. Wouldn't it be better that we'd actually be here on the floor talking to each other, discussing it, and voting on amendments if necessary? In a perfect world, I'd like to pass that just the way the House sent it to us and get that into law immediately. The President has signed on. The House has signed on. You have Republican leadership. You have Democratic leadership. Why is this chamber not acting? But then we must immediately go to this broader strategy, this stimulus to support our economy through this collapse, to try to keep the collapse from being as severe and try to shorten the period before it can be restored. Now, that period is going to depend a lot on how successful we are in interrupting the course of this disease. That's why it's so important. Social distancing is so important. We have to stop the disease from moving from one person to another. The disease is on the march against America, and we have to interrupt it. We have to bring it to a standstill. But meanwhile, we have to help those families and businesses being so profoundly affected across America. Let's rebuild this economy from the bottom up, paying attention to the impact on families and the impact on small businesses. John F. Kennedy once put it, in a time of domestic crisis, men of goodwill and generosity should be able to unite regardless of party or politics. That's what we did after 9/11. That is exactly what must happen today. Let us not be moved by the powerful and the wealthy to give yet more wealth and power to them. Let us be moved by the fact we are all Americans in this together. Let us tend to the fundamental needs of health care and housing and education, and most importantly, good jobs as those jobs disappear across America. Let's pay attention and work together to shore up small businesses with low-interest loans and with grants to see them through this difficult time and their employees through this difficult time. Thank you, Mr. President.
Mr. President.
Senator from West Virginia.
Mr. President, thank you. I want to thank my colleague from Oregon for his big heart and his compassion and continue always worrying about those who are left behind and forgotten. I can assure you that Senator Merkley does not leave anybody behind, or he never forgets those who are in need of help. Let me just say, in speaking about what we're dealing with, unlike anything we've ever seen in my lifetime and in most people's lifetimes. Up until a couple days ago, my state of West Virginia felt like they were immune. There was no cases reported. We were like an island in a sea of infestation around. I knew that was not the case, but many people did not know that we just weren't testing. And the amount of tests were just not out there in the priorities. So people had a false sense of maybe hope or security, and now that has been shattered. We have our first case now, and I think I'm praying to the good Lord that we don't have many more, but I suspect that because of the fragility of our citizens, the elderly population that we have, those who have done hard work all their lives, have respiratory illnesses that could be in jeopardy, and we're very concerned about that. I was reluctant about coming and speaking, but I think there's some things that need to be said because we're moving in an unprecedented way of how much money should be thrown at a pandemic. How much money do they believe it will take to get us through this horrible time? Well, first of all, we should be thinking about, are we investing in trying to build our healthcare defense system back up? That's been basically decimated in the last 2 or 3 years. Should we not put the scientists and the people who know back in the position that can be looking at any of these horrible illnesses, diseases, and pandemics, viruses that were coming from different parts of the world that can protect us from it hitting our country again like this? Next of all, should we not be putting everything we have as far as our research capabilities and working with all the scientists and all of the different centers that we have, that we could find basically a way to treat this virus and a vaccine that would prevent those from contracting this virus? Those are the things that we should be totally, absolutely committed to and spending our time and effort immediately upon. Next of all, the financial help that we are going to need. First of all, don't you think we should be using this through every challenge that we've ever had in this great country? We have found a way to come out of it bigger and stronger. But don't you think we should be manufacturing the medical devices that we need to heal and cure and take care of American citizens right here in the good old USA? Don't you think we should be having the amount of products it takes to make the pharmaceutical pills that we need in order to keep us healthy or cure us, if you will? Don't you think some of that should be done in the USA that we've allowed to leave our shores and find in desperate need? Don't you think we should be making just a medical mask to protect our first responders and all of our medical workers who we need to have on the job? Those are the things we're worried about with the fallout that can come from this horrific epidemic. But it gives us a chance to reconnect, basically, and also a way to correct maybe the lackadaisical approach we've taken to manufacturing over the years. This is a time for us to change. But let me throw something else at you, Mr. President. I don't think that you and I need a $1,000 check. I don't think we need that. I think there's an awful lot of people in America that still have a job, even if they're working from home, that basically is not going to change their life with that $1,000 check. But think about the people that truly do need that and a lot more. People on the front line that have no control over this whatsoever, that doesn't have a guaranteed source of income unless they're out there earning it every day. Don't you think we can help them more through expanded unemployment benefits, working through the system that we already have in place in all of our states and in this country? Don't you think that might be a better way? How about the small businesses that aren't capitalized to the point to where they have no ability whatsoever to continue to operate when there's no capital and they don't have cash flow or reserves to take care of it? Don't you think we can help them through the SBA, removing some of the restrictions and red tape that we have? Unemployment benefits, basically waiting on wait times, increasing that to a $500 a week limit, things of that sort that would help. Don't you think the large corporations, which I know everyone's concerned about, they got one tremendous tax break. Now, with that being said, they will come back. They can afford to pay back a loan of 0% interest, if you will, helping some way, keeping that part of the economy stimulated, but not to the point where we're putting our children and grandchildren in a debt that we could avoid, but not being compassionate and sympathetic towards those who really need it on the front line, which is the average working person that gets up every day and finds out there's no work for them. They're already on the unemployment. They're in the system. Also, the small businesses that have struggled, they're there. We're to the point now where we're going to bite off a lot more, and we're going to write checks that our children can't cash. That's exactly what we're doing if we're not smart about this. And it seems that everyone's just gathering around now, okay, for whatever type of cover. I'm not sitting here blaming the president or blaming any administration or anybody else for what we didn't do 2 or 3 or 4 months ago. I'm sitting here now, are we going to take responsibility for what we're about to do that doesn't make any sense whatsoever? So with that being said, let's make sure the money that we're putting in the system is fixing the medical end of it, finding a cure for this virus, making sure that other viruses or pandemics don't attack us. Let's make sure that we're doing everything that we can of what we're responsible for. Every leader takes an oath of office. When you raise your hand, whether you're a mayor, whether you're a governor, whether you're the president, whatever, you should be thinking immediately upon taking that oath, what can I do to protect the people that I'm responsible to represent? If you can't do that, then you're going into the wrong job with the wrong idea, I can assure you of that. So what I'm saying is I've got the most at-risk population in the country, an older population, and a population that's done heavy lifting and heavy jobs that's basically given respiratory concerns and ailments. They are most vulnerable, and this pandemic could take a horrific toll on the population of the state of West Virginia if we're not careful what we do, but also it can change the course of how we do business and how we look after each other in America. This is asking all of us, this is challenging every one of us to bring in the humanity inside, the compassion, bring in basically the who we are as a people. The American people are the most generous, caring, compassionate people. West Virginians treat everybody as their neighbor, and that's who we are. We must take care of our neighbors. We must reach out and help those in need. And right now, we have a situation where I'm concerned about that all of us have not done our job as well as we could. And just throwing caution to the wind, thinking we can make everybody happy if it's political coverage, because we're going to be throwing money at everything, thinking this will take care of it. It won't. It won't unless you have a root cause of the problem that we're getting to. And that is fixing our manufacturing base, taking care of Americans, making sure people that can't work on no recourse of their own and no desire by themselves, but they have absolutely no challenging from the standpoint of where they have, where they're able to basically have control of their destiny. They're requiring basically to provide the services, and that means the jobs have to be there, that means the demand have to be there. We've cut most of that out. Let's make sure we take care of them. Let's make sure, and we can do that without bankrupting our future generations. I think that can be done. I will say this. I spoke to Vice President Mike Pence last night and told him the dire need that we were in. I said, Mr. Vice President, I know that people are thinking West Virginia has been spared. We have not. We just haven't tested. We need more test kits. We need more protected for our first responders. We need respirators and ventilators. We need the tents as first tier operations. We're not in a second tier. We're too vulnerable to be in that second tier. If you want to stop the carnage that could happen if this thing breaks loose in my state full-fledged, then please help us. He's responded. And I want to thank the Vice President for basically reaching out, helping West Virginia, and we're going to get through this. There will be a light at the end of the tunnel. There will be a new day, and we have a chance to correct the problems that we have right now. This has been of our own makings, and we can correct them by our own actions right now. So I want to thank you, Mr. President. I hope all of our colleagues are working in a bipartisan way. It should bring us together. There's very few times that this opportunity comes. And I've said in the political arena, you have two things that happen. You better never, ever, ever not take advantage of a crisis and make something better happen. And that's what we're dealing with now. And basically a mandate. The people are mandating us to do our job. They're mandating us to work together, to find cures, not to basically be irresponsible or act like we're not in touch with the average person. We are, because that's who we represent. Thank you, Mr. President. I yield the floor.
Senator from Oregon.
Mr. President, shortly the Senate will vote on the Paul Amendment, and I want this body to understand why I strongly oppose it. The Paul Amendment, in its essence, has nothing to do with the underlying proposal responding to this enormous COVID-19 crisis. The Paul Amendment is a poison pill that essentially focuses on an old political issue that this body has debated before and very likely is going to debate again. I just don't believe the Paul Amendment has any place in a debate on an emergency coronavirus bill. Every member of this Senate understands our country is facing and dealing with a national health and economic crisis. The country wants us to focus like a laser on emergency measures that can help save lives and keep families from falling into destitution. The Paul Amendment says, in effect, that immigrant families with kids are going to pay for the emergency with their kids' well-being. These families, like so many others, are especially vulnerable at this moment. It's just wrong to bring misery into their homes. I would just ask my colleagues, save the immigration debates for another time when we're not in the middle of a pandemic. Today, the focus is about that pandemic and acting in an emergency where we come together, both political parties, both sides of the aisle. When you're dealing with this kind of pandemic, your focus is helping families and workers, small businesses, all of those people who are walking on an economic tightrope. They're not getting paychecks, is what we're hearing, and they're trying to figure out how to pay their rent. And if they pay the rent, do they have money for food? And if they have money for food, what do they do about out-of-pocket health care? Folks want our support with those survival issues. On the Finance Committee, very pleased to see the distinguished president of this body working with us on the Finance Committee. What we have tried to do is focus on modernizing unemployment insurance. I've said to my colleagues, let's just face it, unemployment and the system for it has been in a time warp. So I think we've got a really important proposal that's going to help an enormous number of people from sea to shining sea. So we need to do so much right now, particularly in terms of saving lives and getting health care to our people. And what I hear from home is people who are following this are saying there's so much to do. Act now, then get on with the additional steps that have to be taken. But for today, get on with it. Get on with passing this bill, getting ready to move to the next bill. Those in need of health care, citizens struggling to make it through these unprecedented times want action now. They all realize that there will be several additional pieces of legislation, hopefully sooner rather than later. But our job today is to make sure we pass this bill, and I urge colleagues, when we vote on the Paul Amendment very shortly, to oppose it, and I yield the floor.
Mr. President.
Senator from Kentucky.
Mr. President, I rise in support of my amendment to pay for this economic stimulus package by removing less important spending from elsewhere in the budget. I would ask every American, if you were faced with a personal crisis and how to spend extra money, and you had to spend extra money on food and medicine, money that you had to borrow from a relative, wouldn't you prioritize your resources and immediately stop loaning money to friends overseas for their children to go to, for example, space camp? Wouldn't you stop funding clown colleges in Argentina? If you had a true emergency like this pandemic, wouldn't you stop building roads and gas stations in Pakistan? If you had a true emergency like this corona pandemic, wouldn't you immediately stop spending money studying why drunk people fall down more than sober people? I ask my colleagues to stop wasting money in this time of crisis. Stop being a rubber stamp for wasteful spending. Do your jobs and prioritize our precious resources. It is our job and our responsibility to conserve these resources. Why is this important? Why shouldn't we just print or borrow the money instead of making cuts in things like foreign aid? Because next time, maybe in the not too distant future, our children may not even be able to borrow their way out of a crisis. Our dollar will be devalued, our economy ruined, all because we will have been profligate fools with our resources. All because we refused to do what we were elected to do, which is to prioritize the truly vital, such as coronavirus relief and medical research, over the extraneous, such as spending money on clown colleges, gas stations, and roads in Afghanistan. To my fellow Americans, remain hopeful, remain kind, remain faithful, and above all, remain resilient. In the world's history, pandemics are the norm, not the exception. It is only recently, in the modern era of antibiotics and vaccines, that pandemics have become less frequent. Ever since vaccines eradicated polio and smallpox, modern man has become accustomed to the idea that life is relatively safe, that a long life is to be expected. Consequently, any re-eruption of diseases beyond our control paralyzes us with fear. People have forgotten what it was like to experience the annual dread of recurring infectious disease. My parents remember vividly the polio pandemics of the 1950s. In one of the last great outbreaks of polio before the vaccine, almost 60,000 people contracted polio and over 3,100 died. Jonas Salk was greeted as a conquering hero for developing the first widespread polio vaccine, but that was nearly 70 years ago. In the early 18th century, Dr. Zebediah Boylston showed great courage in introducing inoculation for smallpox. Within a generation, smallpox was on the wane and ultimately defeated when Edward Jenner discovered how to vaccinate using the milder cowpox. This latest pandemic already has heroes, some known, but most of these heroes are unknown, doctors and nurses on the front lines. The innovators among us are already putting forth potential treatments, possible cures. A half dozen antiviral medications are in the final stages of study. Researchers believe that an old drug developed for malaria may help. Reports indicate that scientists will likely set a speed record in developing a vaccine. Now is not the time for malaise. Now is the time for optimism. By summer, there is a very good chance we will be in the recovery phase. Now is not the time to give in. Several generations have grown unfamiliar. They've grown up unfamiliar with the devastation of pandemics. And even now, when it's impossible to look the other way, the young and healthy rationalize their relative safety. Psychologically, it's easier for the young and healthy to view mortality as something that happens to the old and unhealthy. Coronavirus scares us because it kills not only the old and infirm, but the young and vibrant, although much less frequently. One of the coronavirus's first victims was a 32-year-old previously healthy ophthalmologist in Wuhan. The question is not how serious is the pandemic or whether we should act, but whether there is a plan of action that can preserve our economy and lead to a quick rebound. I don't think anyone will ever know for certain whether grinding the U.S. economy to a halt was necessary. Likewise, no one can really know the converse, what would have happened had we not attempted to slow the virus's spread. It is useful, though, to remember that just 10 years ago, we suffered the swine flu pandemic, and the swine flu was no walk in the park. It is estimated that about 60 million Americans were infected and over 12,000 people died. Now, experts have said that the coronavirus is much more lethal than the swine flu. Likely true, but worldwide deaths from the swine flu were estimated to be between 150,000 and 575,000. When calm returns, it will be helpful to examine how our responses differed between the swine flu and the coronavirus. At one time, we were completely helpless before the ravages of natural disasters, such as infectious diseases. But our history is one of great innovation and perseverance. We will survive this pandemic. What government does to mitigate the calamity should be short-lived, temporary, and cause as little distortion to the free market economy as possible. The history of pandemics indicates a strong likelihood that the peak of infections and mortality could pass in a few weeks to a few months. Congress should remain calm and try not to explode the debt in our response. The public should know that Congress has already enacted reforms that will free up millions of industrial masks to be used by our doctors and nurses. Thoughtful sequestration and quarantining is in place and helping. And in addition, I have introduced legislation to allow our university labs and advanced private labs to be able to develop additional testing for coronavirus and possible cures by removing red tape at the FDA. I do worry, though, that as we go further into debt, we may reach a point where our debt is so large that we are unable to manage the next pandemic. We should never forget fiscal responsibility, even in a crisis. We should pay for any new federal funding by taking that money from areas of the budget where it is not being wisely used. My amendment does just that. My amendment says that if you want to apply for money from the government through the Child Tax Credit Program, this is money that the government gives to people, that you have to be a legitimate person. You have to have a Social Security number. We've been talking about this reform for a decade now, and we never seem to be able to get it passed. It has nothing to do with not liking immigrants. It has to do with saying taxpayer money shouldn't go to non-people. You should have to be a person to get taxpayer money. It just says you have to have a Social Security number. People estimate this would save $26 billion. That goes a long way towards paying for this bill. I think we should also end the war in Afghanistan. We're spending $50 billion a year on that war, and it's mostly not to fight war, it's to build stuff for them. It's to build infrastructure for them. We've got a lot of problems with infrastructure in our own country without spending $50 billion a year in Afghanistan. If we have a true emergency now, it's our job to prioritize, to take that money from where it's not being spent wisely to spend it on something that we need at the moment. My bill also allows the president to look throughout the budget and transfer money from any other wasteful areas. If you look at our budget, it's loaded with waste. Nobody ever calls the waste. And we have an emergency and they say, let's just borrow more money. Instead, what we should do is we should actually take money that's unwisely spent and move it over to account for this emergency. What I'm offering is a very reasonable proposal. We simply pay for this emergency bill by taking money from other areas of waste in the budget. Thank you, Mr. President.
Mr. President,
The Majority Leader.
I ask unanimous consent that the Senate proceed to the immediate consideration of H.R. 6201. Further, that the only amendments in order be amendments to be offered by Senators Paul, Johnson, and Murray, or their designees, the text of which are at the desk. Further, at 12:10, the Senate vote on the Paul amendment subject to a 60 affirmative vote threshold for adoption. Further, following the disposition of the Paul amendment, the time until 2 p.m. be equally divided between the two leaders or their designees, and that at 2 p.m. the Senate vote on the Murray and Johnson amendments in the order listed with a 60 affirmative vote threshold for adoption of each. Further, upon disposition of these amendments, the bill as amended, if amended, be read a third time and the Senate vote on passage of the bill with a 60 affirmative vote threshold for passage. Finally, if passed, the motion to reconsider be considered made and laid upon the table, and that all votes be 30 minutes in length.
Is there objection? Without objection. The clerk will report the bill.
01, an act making emergency supplemental appropriations for the fiscal year ending September 30, 2020, and for other purposes.
Mr. President,
Senator from Kentucky.
I call up my amendment 1556 and ask that it be reported by number.
Without objection. The clerk will report the amendment by number.
Senator from Kentucky, Mr. Paul, proposes an amendment numbered 1556.
Is there a sufficient second? There appears to be. The clerk will. The yeas and nays are ordered. Romney's not here. Thanks.
Senator from Kentucky is recognized.
I ask unanimous consent that the vote scheduled at 12:10 be allowed to begin now.
Is there objection? Without objection. Questions on the Paul amendment? Yeas and nays were ordered. The clerk will call the roll.
Mr. Alexander, Ms. Baldwin, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mr. Braun, Mr. Brown, Mr. Burr, Ms. Cantwell, Mrs. Capito, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Mr. Enzi, Ms. Ernst, Mrs. Feinstein, Mrs. Fisher, Mr. Gardner, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Ms. Harris, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Ms. Hirono, Mr. Hoven, Mrs. Hyde-Smith, Mr. Inhofe, Mr. Johnson, Mr. Jones, Mr. Kane, Mr. Kennedy, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Leahy, Mr. Lee, Mrs. Loeffler, Mr. Manchin, Mr. Markey, Mr. McConnell, Ms. McSally, Mr. Menendez, Mr. Merkley, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Paul, Mr. Perdue, Mr. Peters, Mr. Portman, Mr. Reed, Mr. Risch, Mr. Roberts, Mr. Romney, Ms. Rosen, Mr. Rounds, Mr. Rubio, Mr. Sanders, Mr. Sass, Mr. Schatz, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Shelby, Ms. Sinema, Ms. Smith, Ms. Stabenow, Mr. Sullivan, Mr. Tester, Mr. Thune, Mr. Tillis, Mr. Toomey, Mr. Udall, Mr. Van Hollen, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young, Mr. Paul voted in the affirmative. Senators voting in the negative: Cantwell, Durbin, Enzi, Hassan, Heidsmith, Loeffler, Menendez, Murray, Peters, Rosen, Udall, Whitehouse, and Wyden. Mr. Warner, no. Mrs. Shaheen, no. Mr. Daines, no. Mr. Tester, no. Mr. Reed, no. Mr. Grassley, no. Mr. Barrasso, no. Ms. Smith, no. Mr. Cardin, no. Mr. Manchin, no. Mr. Cotton, no. Mr. Toomey, no. Mr. Murphy, no. Mr. Inhofe, no. Mr. Rounds, no. Mr. Kane, no. Mr. Roberts, no. Mr. Johnson, Mr. Johnson, no. Ms. Cortez Masto, no. Ms. Sinema, no. Mr. Merkley, no. Mr. King, no. Mr. Cornyn, no. Mrs. Gillibrand, no. Mr. Heinrich, no. Mr. Schatz, no. Ms. Harris, no. Mr. Cassidy, no. Mr. Jones, Mr. Jones, no. Mr. Hawley, no. Mr. Wicker, no. Mr. Romney, no. Mr. Sanders, no. Mr. Bennett, no. Mr. Kennedy, no. Ms. Klobuchar, no. Ms. Warren, no.
Okay, well, we've got, yeah, very good. Some there, even better. A big tub of them.
Correct. Mr. Graham, no. Mr. Braun, aye. Mr. Casey, no. Mr. Shelby, no. Ms. Stabenow, no. Mr. Carper, no. Ms. Hirono, no. Mr. Cruz, no. Mr. Young, no. Mr. Sass, no. Ms. Ernst, no. Mr. Markey, no. Ms. Baldwin, no. Mr. Thune, No. Mr. Tillis? No. Mr. Leahy? No. Mr. McConnell? No. Mr. Blunt? No. Mr. Van Hollen? No. Mrs. Blackburn? No. Mr. Alexander? No. Mr. Schumer? No. Mr. Perdue? No. Mrs. Capito? No. Mr. Moran, no. Mr. Kramer, no. Ms. Duckworth, no. Mr. Booker, no. Mr. Brown, no. Mr. Rubio, no. Mr. Risch, no. Mr. Crapo, no. Mr. Burr, no. Ms. Collins, no. Mr. Scott of South Carolina, no. Mr. Coons, no. Mr. Langford, no. Mr. Bozeman, no. Mr. Blumenthal, no. Mr. Hoven, no. Mrs. Feinstein, no. Mrs. Fisher, no. Ms. McSally, no. Mr. Lee, aye. Mr. Portman, no. Ms. Murkowski, no. Mr. Sullivan, no.
This is all I got to do? No one's listening. The yeas are 3, the nays are 95. Under the previous order requiring 60 votes for the adoption of this amendment, the amendment is not agreed to.
President,
The senator from New Hampshire.
Mr. President, Granite Staters are known for our all-hands-on-deck spirit, coming together in difficult times to support our friends and neighbors. The COVID-19 pandemic has forced us all to change our daily routines and adjust to new challenges. However, one thing that has not changed throughout this public health emergency is the compassion and empathy we are seeing from people all across our state. Every month, I recognize a person or a group of people in New Hampshire who have gone above and beyond to help their community. I recognize them as the Granite Stater of the Month. But this month, I couldn't choose just one person, and instead wish to recognize all Granite Staters for coming together to try to slow the spread of this virus and to help those in need. All across New Hampshire, people are taking common sense steps both to keep themselves healthy and to avoid unknowingly passing along the virus to others, particularly those who are at high risk. This includes washing your hands thoroughly and for at least 20 seconds, and wiping down frequently touched surfaces like cell phones and door handles. It also means practicing social distancing by only going out in public when absolutely necessary and keeping at least 6 feet between you and another person. We've also seen that events that people look forward to all year, like the Boston Marathon or St. Patrick's Day's festivities, have been canceled or postponed. People are following public health officials' guidelines by staying at home and canceling long-awaited travel plans. Taking these necessary measures is hard and unpleasant, but it has been inspiring to see how many people are willing to make these sacrifices to protect the public health. Additionally, many people might only contract mild symptoms from COVID-19, especially those who are younger and in good health. However, it is heartening that so many of those individuals recognize how important it is to protect others who might be at higher risk, like those over 60 or people living with chronic health conditions. As many Americans know, it's also crucial that we don't overwhelm our healthcare system and prevent an influx of patients from crowding hospitals, which could lead to a shortage of critical medical equipment and personal protective gear. Collective actions, like staying home and minimizing interactions with others, will be crucial in combating this public health emergency. As people's lives continue to experience disruption, I have been inspired to see such a tremendous outpouring of support from people all across New Hampshire in an effort to help one another during this very difficult time. For instance, nonprofits, food pantries, and volunteers are partnering with local schools in New Hampshire to combat food insecurity in their communities. One school district held a food drive over the weekend with a local nonprofit. They were concerned that given the last-minute nature of the event, there would be low participation. To their surprise, the school reported that the community came out in droves to donate goods. Stories like this are abundant in communities across my state, and I am immensely proud of how people across New Hampshire have come together to respond to this public health emergency. In the coming weeks and months, it will be even more important that Granite Staters and all Americans lean on one another for support. I encourage everyone to reach out to your neighbors, especially those at higher risk, to see what you can do to help. If you have an older neighbor, see if they need help picking up their groceries. If you know someone who is a medical professional with young kids at home, ask if you can babysit. Right now, it is important for people to remember that what we can all do to help contain the spread of this virus, and that we all have a role to play in doing so. In New Hampshire, we pull together, and we help one another to get through challenging times. And I know that we can come together to slow the spread of this virus. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from Texas.
Mr. President, as healthcare professionals and first responders and communities across our country are working around the clock to fight the threat of this coronavirus, our televisions and news feeds have been filled with a lot of numbers. The number of cases, new cases reported each day, the rising number of fatalities, unfortunately, the volatile ups and downs of the stock market. All this data paints a picture of a widening scope of this outbreak on a national scale, but it fails to represent the impact it's having on individuals and on small businesses and on our communities. I think of people like Joe Kinney, who opened Cobblehead's Bar and Grill in Brownsville, Texas, nearly 25 years ago. Like other restaurant owners around the country, he's trying to adapt so he can keep his doors open while following guidelines from the Center for Disease Control. He canceled the restaurant's popular St. Patrick's Day celebration and instead offered corned beef and cabbage as a takeout option. But he's nervous just how long he can hold on and how he will be able to stay afloat. Joe says shutting down 2, 3, 4 weeks, you can leave 25 years on the table with what we put into this place. Joe, to his credit, is especially worried about his more than 30 employees and what will happen to them. This is a familiar story for countless small businesses and their employees who are losing customers through no fault of their own. Erin Willis owns RM 1220 Bistro in Northeast Dallas. When she heard Mayor Johnson's announcement limiting restaurants to takeout service, she said, "I just hope we can survive this." Like Joe, Erin is mostly concerned about the well-being of her staff. Hourly workers, particularly those who rely on tips, are seeing fewer and fewer opportunities to collect a paycheck. Erin's rotating employees so that everyone can have some work, but the fears about how long this could last are really settling in. As she said, the service industry is their livelihood. If we all close, they literally have nothing. As more and more Americans are staying home, small businesses and their employees are the hardest hit. But the impact does not end with them. The hard stop on large gatherings doesn't just mean businesses, schools, and workplaces are shutting down. It means vital community events, including things like blood drives, are being canceled. Officials from the South Texas Blood and Tissue Center said this has put their community blood supply at risk of collapse. And while this isn't related to treating those diagnosed with coronavirus, it is a vital, ongoing, everyday work of our healthcare system. Blood donations help people who lose blood during major surgery or a traumatic injury, as well as those with chronic conditions that require occasional transfusions. Hospitals and donation centers are taking every precaution to protect donors while fulfilling their need for blood donations. And I would encourage all Texans who are healthy and at low risk of contracting the coronavirus to consider donating blood. During times like these, when it's perhaps easy to feel that circumstances are beyond your control, this is one small step each of us could take to support our communities. I know this is a time of serious uncertainty for both the physical and financial health of our families and our country, but I want to assure my constituents, the 29 million people that I'm privileged to represent in the state of Texas, that the Senate is working to provide the relief we can. Less than 2 weeks ago, the President signed a bill we passed that provided $8.3 billion in emergency funding to combat the virus. This sent vital funding toward treating and preventing the spread of the virus, including the purchase of masks and personal protective equipment, as well as supporting the development of a vaccine, possible treatments, and more diagnostics. This was an important first step to bolster our response in the early phases of this community spread. And now we're working to address the larger impact this virus is having on American workers, families, and our economy. Soon, the Senate will take another bipartisan step to provide support by passing the Families First Coronavirus Response Act. This legislation will go a long way to provide immediate relief for those who are struggling to make ends meet during this challenging time. It creates a new federal emergency paid sick leave program for those impacted by the coronavirus. Whether a worker is diagnosed with the virus or caring for a dependent who was affected, they'll be able to take up to 10 days of paid sick leave. And many Texas workers will have access to 12 weeks of paid leave for care for dependents because of coronavirus-related school closures. This legislation will make important changes to unemployment insurance to ensure that Texans can take advantage of these benefits during this time of uncertainty. It also provides food security for Americans of all ages, from school children who rely on free lunches at school to seniors who are unable to leave their homes. Every American deserves access to this basic nutrition. This bill also makes coronavirus testing free of charge for all Americans and includes a range of measures to support the healthcare professionals who are literally on the front line of this fight. I proudly will support the bill, and I'm eager to get it to the President for his signature. We shouldn't delay in sending it to his desk. We've been able to come together and move 2 bills through Congress that will support healthcare workers, neighbors, and communities being impacted by the coronavirus. And I hope this trend of bipartisanship will continue in the coming weeks and months as we work to build on the actions we've already taken. I want to echo the comment made by the Majority Leader that this is only the beginning of our efforts to support our country. We'll keep working this week and next and for however long it takes to assist American workers and families, to support our local businesses, and secure both the immediate and long-term viability of our economy. The Senate has already begun work via 3 task forces of putting together the next economic recovery legislation, and we will not leave until we get that bill passed, too. While most Americans' daily lives have been upended by the spread of the coronavirus, there are countless men and women who are continuing to go to work and fill critical needs in our society. We owe a debt of gratitude to the dedicated healthcare professionals who are on the front lines of this pandemic, and to the scientists who are working diligently to develop a vaccine, the first responders who continued to expose their own health for our safety, to the farmers and ranchers and producers who are keeping us fed, to the grocery store employees who are restocking shelves, and to the countless others who are leaving their homes and their families each morning to keep us safe and healthy. And we need to say thank you to each of them. While these men and women continue doing everything they can in response to the spread of the coronavirus, the Senate will do the same. Mr. President, I yield the floor, and I would note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
Madam President.
The senator from Washington is
Madam
recognized.
President, I ask unanimous consent the quorum call be lifted.
Without objection.
I call up amendment number 1559 as provided for under the previous order.
The clerk will report.
The senator from Washington proposes an amendment numbered 1559 at the appropriate place.
Madam President, I ask unanimous consent this we dispense with further reading.
Without objection.
Thank you. Thank you, Madam President. Madam President, I have been in the Senate during 9/11, for Katrina, for the 2008 financial crisis, and I still have never experienced anything like what we are seeing today. These are truly extraordinary circumstances, and the stories that I am hearing from my constituents and from people across the country are crushing. And some of the most heartbreaking stories are the ones about people who want to do the right thing in this moment, but are having to choose between staying home, as public health experts say we must, and paying the rent or putting food on their table. I am hearing from workers like Crystal Westwood. She's from Auburn, Washington. She and her husband just welcomed their first child on February 7th of this year. They both have autoimmune diseases, but her husband's job is not allowing him to work from home. And she says, and I quote, "This is an extremely stressful situation for our family. We have the option for my husband to take leave without pay for the next month or so, but that would mean we would not have any income coming in to support our family. He could use up all of his sick and vacation time, but that would mean he won't have any left for the rest of the year in case something happens. Both of those options do not seem right." Madam President, I agree, that is not right. A pastor in Tukwila, Washington, shared similar concerns from a parent in their congregation with school-aged children who worries, and I quote, "What if they call off school? I don't have anyone to care for my kids. Then without a paycheck, we will get evicted. As it is, we are already running close to eviction every month." Madam President, since that time, all of our schools in Washington State are closed. And then there's Chris. He lives in Seattle, works in a grocery store, and is at high risk for coronavirus. She writes, "It is an awful decision. Go to work and put your life at risk, or lose your job, your income, and your insurance. I haven't committed either way at this point. I'm trying to find a way to stay home." Madam President, I'm not just hearing from workers, but from small business owners as well across our state, people who own restaurants and shops, everyone from farmers to fishers who are used to the spring being a time when the phones are ringing off the hook. Now no one is coming in their door, no one is calling, and they want to do the right thing for their workers, but they don't have the cash flow to keep them on. Madam President, people are scared. They feel they've gotten the rug pulled out from under them. They need our help. Unfortunately, here's what the senator from Wisconsin wants to do. After the House overwhelmingly passed a bipartisan agreement that includes an important step forward to provide workers the paid sick leave they need in this crisis, his amendment would undo that bipartisan work by stripping any paid sick leave progress out of the bill we're voting on today. Instead of helping people keep their jobs and their paychecks by providing sick leave, Senator Johnson's amendment would force workers to seek compensation through their state unemployment system, meaning they'd be on their own until they were compensated by the state. And the unemployment system in each state would be drastically overburdened at a time when workers are going to need it in the event they're laid off. Democrats are pushing for solutions through the unemployment insurance to support families and workers in the months ahead. But simply using this program now as a replacement for paid sick leave workers is unacceptable and it's shameful. We have to do better than that. At a time when families are facing impossible decisions, my fellow senators face a glaringly simple one. We need to be doing as much as we can, as fast as we can, and his amendment would set us backwards at the worst possible time. That is why I'm here on the floor to offer our amendment. It's based on legislation that I've worked with Senator Gillibrand and Representative DeLauro to introduce yesterday. Our legislation will simply provide workers with 7 days of accrued paid sick leave, 2 weeks of paid emergency days, and 12 weeks of paid emergency leave. and it would make sure that their employers can quickly and fully be reimbursed by the Treasury Department for providing that leave. But for those who may not be ready just yet to agree we need paid sick days and paid leave going forward permanently, the amended version of this bill that we are introducing today and asking for a vote on shortly would only provide this support through December 2021. My number one priority right now is getting people the support they need right now for this emergency that's at hand. And this is a common sense step. It is good for workers who need to stay home if they are sick or take care of their family without losing a job or their paycheck. And it's good for small businesses who want to keep their workers and communities safe and who are struggling to stay afloat during this crisis. It is the right thing to do for our economy, for our public health, and we should get it done as soon as possible. If we don't do this, if we let this opportunity slip by, we are sending a message to scared people across the country that we are still not willing to acknowledge the scope of the tragedy we are seeing unfold and not listening to the stories like the ones I just shared, stories that I know my colleagues have heard as well. Madam President, we must not. We cannot send that message. People need help. They need hope. They need to see that we are willing to do the right thing and pass big solutions. So I hope all of our colleagues join us in supporting our amendment. I want to see this passed, sent to the President's desk as part of this response. And by the way, I'm not going to stop fighting until that happens. Thank you, Madam President. I yield the floor.
The senator from New York is recognized.
Across New York State and the whole country, schools are closing, businesses are shutting their doors as we face this unprecedented crisis. The public health emergency has exposed the weakness in our economy and in our system. We are not doing nearly enough for workers, for their families, and those who need to deal with medical and financial emergencies that this virus has caused. Congress has a duty to look out for families who are staring down uncertainty, fear, and financial ruin. Our top priority must be strengthening our public health system and ensuring that hardworking Americans who are facing this crisis due to no fault of their own can keep their jobs while taking care of themselves and their loved ones. We must also ensure that businesses, many which have been forced to close their doors in the name of the public good, do not have to cover these unexpected costs alone. The Paid Leave Act ensures that every worker in America has full paid sick and family leave. It strengthens their financial footing. It gives certainty and confidence to businesses. Congress has the responsibility to pass this legislation. It's not only a health imperative, but a financial one too. Unfortunately, our colleague, Senator Johnson, his amendment is cynical and counterproductive. This amendment would eliminate paid sick and family leave provisions in favor of providing coronavirus-affected people with unemployment compensation. So what he's saying is you have to actually lose your job if you need to stay home to care for a loved one or because you're sick yourself. And that's just wrong-headed, because the truth is we want people to keep their jobs. We want people to be able to have their jobs be there when they get better or when their family member gets better. We want them to have their jobs after they recover themselves. This is why paid leave and sick leave is such a better solution than just straight-up unemployment insurance. Workers deserve protections so they don't lose their job just because their kids' school closed and they need to be home to look after them. Wouldn't any employee in America today prefer to keep their job and have paid sick leave rather than having to quit and take unemployment insurance? Wouldn't every member of this body and President Trump himself, want to keep unemployment numbers from exploding any further than they are already? While the unemployment system will continue to play a very important role for those who have lost their jobs, It cannot be the only answer. I want to thank Senator Murray for her leadership, her steadfast advocacy for family and medical leave and paid sick days. This amendment is crafted to provide extraordinary economic stimulus and support to our businesses when they need it absolutely most. And most of all, it's giving certainty because people are afraid. They don't want to have to spread coronavirus to every person they work with. They don't want to have to leave their children unattended at home. They would love to stay at work, but under the circumstances, they cannot. Allow them to keep their jobs, allow them to draw down on paid leave while their child is at home for a week, a month, or 3 months. If they themselves are sick, God forbid, make sure they're not in the community spreading this virus. Make sure they can be home, getting better, and reemerging to do their work when they are well. Democrats stand ready to work with Senate Republicans to pass this important bill. We need to meet the need of the American people today. This is our duty in this grave time of need. I yield the floor.
Madam President,
The senator from Wisconsin is recognized.
I call up my amendment number 1558 and ask that it be reported by number.
Without objection, the clerk will report the amendment by the number.
The senator from Wisconsin, Mr. Johnson, proposes an amendment numbered 1558.
Madam President, I also ask unanimous consent that Senator Blackburn, Senator Cotton, Senator Cruz, Senator Loeffler, and Senator Perdue be added as co-sponsors to my amendment 1558 to H.R. 6201.
Without objection.
I also ask unanimous consent that I be allowed and the senator from Pennsylvania be allowed to finish our comments before we start the vote.
Is there objection? Without objection.
Thank you, Madam President. Madam President, we are facing with the coronavirus an unprecedented situation, certainly in my lifetime. These are extraordinary times we're living in and trying to live through. And there's no doubt that extraordinary times require extraordinary measures. The good news is that there's a lot of agreement in terms of what we need to do. We all recognize that Americans and American businesses are suffering through no fault of their own, and they need help. And we all want to provide that help. Hopefully, we want to provide that effectively and efficiently with as few negative unintended consequences as possible. What I would suggest is this is really no time, though, to follow Rahm Emanuel's famous dictate that you should never let a crisis go to waste. Now, Madam President, from my viewpoint, I think one of the reasons we've had a more successful economy, certainly far more successful than the economy, the slow recovery we had out of the 2009 recession, is that this administration has focused on reducing the regulatory burden. First, we stopped adding to it, and then we actually reduced it. That brought a fair amount of optimism, animal spirits to our economy, because business people could actually concentrate on their products and their services rather than looking over their shoulder to find out what new government regulation was going to cause them to hire a new compliance officer, increase their costs, possibly put them out of business. So what I'm suggesting is when we provide that help, and we need to provide that help to both hard-working American workers as well as American businesses, that we do it in the most efficient and effective manner, and we do more good than harm. Now, I would argue that a new mandate on business is going to do a great deal of economic harm. It may sound good, but it's not the right way to go. We will eventually come out of this. We will be recovering from economic woes. We need to learn the lesson from 2009 where overregulation hampered our recovery. So let's not add a new mandate. And I know the House bill is only temporary, but temporary becomes permanent around this place pretty good. As Ronald Reagan once said, the closest thing to eternal life in our lifetime is a government program. I will also say my office has been flooded with businesses calling in, also not believing this is only going to be temporary, and not really having confidence in the Rube Goldberg financing mechanism for this, again, temporary mandate for paid sick and family leave. The good news is there's a better way, and that's what my amendment does. It creates a temporary emergency federal unemployment insurance program sitting on top of what already exists. Rather than having 2 or 3 or more programs trying to provide that funding to workers that we all want to provide, that support, we would have basically a single program, a single method for doing that using state unemployment offices. They're already set up to do this. With some slight modifications, they would be able to handle this. And here would be the slight modifications. First of all, our bill waives any waiting periods. But then we also reimburse the states for paying unemployment during that waiting period. We have the exact same eligibility as the House bill. It is focused on those individuals affected by the coronavirus, the exact same definition. The benefits are identical as well. We would provide support. We would plus up the state unemployment benefits up to 2/3 of employees' wages, not to exceed $1,000 a week. We also recognize those companies that are willing to voluntarily offer sick pay and paid family leave by reimbursing them up to that same level, 2/3 of actual wages up to $1,000 per week, no more than $10,000 per employee, the exact same benefits as the House bill does. And of course, we actually make ours temporary. There will be a great deal of pressure on the part of state unemployment funds to get out of this as soon as they possibly can, but accept that federal help while they need it. So our bill sunsets at the earliest of either the expiration of the national declared emergency or on December 31st, 2020. So, Mr. President, this is a common sense piece of legislation. It does not saddle small businesses, American business, with a new mandate that they don't have a great deal of confidence in. They would actually be funded 100% by the federal government. By the way, the House bill does not fund this 100%. It leaves gaps, and it would definitely be temporary and would utilize an existing program in the states, sitting on top of it, providing federal support for the workers that are going to actually need it as we go through this unprecedented event in our nation's history. With that, Mr. President, I yield the floor to the senator from Pennsylvania.
Senator from Pennsylvania.
Thank you, Mr. President, and I want to thank the senator from Wisconsin for leading on this effort. I rise in strong support of this amendment, Mr. President. The two of us, and I expect most everybody in this chamber, fully support the idea, the goal, the need to provide relief to workers who've been affected by this pandemic. That's not what's in dispute here. There is a legitimate and serious concern about the mechanism by which that is provided. The House bill imposes a very significant administrative burden on the very small businesses struggling to survive. We're all taking these phone calls from all across our states, men and women who are operating a business, and they are on the edge, and they are trying to figure out, how do we stay alive? How do we keep this business alive until we can come out the other side? They are struggling with all kinds of very, very tough decisions that they are having to make for the first time ever in completely uncharted waters. And then this legislation comes along and says, and now, by the way, you're going to have to figure out and navigate your way through a whole new system you've never heard of before. And you're going to have to go through all the books and the rules and regulations and consult your lawyer and figure out exactly how you comply with this complex new mechanism so that you comply with the law and get the reimbursement that's intended. That's a huge problem for these folks who are struggling to stay alive. And so what Senator Johnson's amendment does is it just shifts the substantial administrative cost and burden off the back of the business owner and operator and allows it to be managed by the state unemployment systems who are in the business of providing compensation. And we plus it up and we waive the waiting periods so that the individual workers who are adversely affected by this COVID-19 pandemic will still get the benefits that we all want them to get. It's just a better way to deliver this, Mr. President, and so I hope my colleagues will vote in favor, and I yield the floor.
Senator from New York.
I strongly disagree with both my colleagues' statements because, in fact, there's no administrative burden given to the small businesses. In fact, our bill is doing exactly what the small businesses want, which is direct payments to the businesses, not a tax credit that they get many months in the future, but direct payments to them. I don't think unemployment insurance to be given to the states is going to result in immediate relief for the employees that need it. And again, you're creating a false structure, requiring people to quit their jobs so they can care for a child who's been sent home from school is absurd. It is far better to have a national paid leave program in this country. And unlike what my colleague said, it is not permanent. It is temporary, and there is no administrative burden. I yield the floor to my colleague, Senator. I yield the floor.
All time has expired. The question is on the Murray Amendment. Is there a sufficient second? There appears to be. The clerk will call the roll.
Mr. Alexander, Ms. Baldwin, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mr. Braun, Mr. Brown, Mr. Burr, Ms. Cantwell, Mrs. Capito, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Mr. Enzi, Ms. Ernst, Mrs. Feinstein, Mrs. Fisher, Mr. Gardner, Mrs. Gillibrand. Mr. Graham. Mr. Grassley. Ms. Harris. Ms. Hassan. Mr. Hawley. Mr. Heinrich. Ms. Hirono. Mr. Hoven. Mrs. Hyde-Smith. Mr. Inhofe. Mr. Johnson. Mr. Jones. Mr. Kane. Mr. Kennedy. Mr. King. Ms. Klobuchar. Mr. Langford. Mr. Leahy. Mr. Lee. Mrs. Loeffler. Mr. Manchin. Mr. Markey. Mr. McConnell. Ms. McSally. Mr. Menendez. Mr. Merkley. Mr. Moran. Ms. Murkowski. Mr. Murphy. Mrs. Murray. Mr. Paul. Mr. Perdue. Mr. Peters. Mr. Portman. Mr. Reed. Mr. Risch. Mr. Roberts. Mr. Romney. Ms. Rosen. Mr. Rounds. Mr. Rubio. Mr. Sanders. Mr. Sass. Mr. Schatz. Mr. Schumer. Mr. Scott of Florida. Mr. Scott of South Carolina. Mrs. Shaheen. Mr. Shelby. Ms. Sinema. Ms. Smith. Ms. Stabenow. Mr. Sullivan. Mr. Tester. Mr. Thune. Mr. Tillis. Mr. Toomey. Mr. Udall. Mr. Van Hollen. Mr. Warner. Ms. Warren. Mr. Whitehouse. Mr. Wicker. Mr. Wyden. Mr. Young.
Senators voting in the affirmative: Cantwell, Carper, Gillibrand, Merkley, Murray, Peters, Udall, and Warren. Senators voting in the negative: Capito, Crapo, Johnson, Perdue, Rubio, Toomey, and Young.
Ms. Klobuchar. Ms. Klobuchar, aye. Mr. Reed. Mr. Reed, aye. Mr. King. Mr. King, aye. Mr. Paul. Mr. Paul, no. Mr. Manchin. Mr. Manchin, aye. Ms. Harris. Ms. Harris, aye. Mr. Markey. Mr. Markey, aye. Mr. Cotton. Mr. Cotton? No. Ms. Smith. Ms. Smith? Aye. Mr. Cornyn. Mr. Cornyn? No. Mr. Whitehouse. Mr. Whitehouse? Aye. Mr. Schatz. Mr. Schatz? Aye. Mrs. Shaheen. Mrs. Shaheen? Aye. Mrs. Blackburn. Mrs. Blackburn? No. Mr. Tillis. Mr. Tillis? No. Mr. Grassley. Mr. Grassley? No. Mr. Shelby. Mr. Shelby? No. Mr. Roberts. Mr. Roberts? No. Ms. Duckworth. Ms. Duckworth? Aye. Mr. Jones. Mr. Jones? Aye. Mr. Menendez. Mr. Menendez? Aye. Mr. Wyden. Mr. Wyden? Aye. Mr. Hoven. Mr. Hoven? No. Mrs. Hyde-Smith, Mrs. Hyde-Smith, no. Mr. Daines, Mr. Daines, no. Mrs. Leffler, Mrs. Leffler, no. Mr. Scott of South Carolina, no. Mr. Langford, no. Mr. Kane, aye. Mr. Heinrich, aye. Mr. Barrasso, no. Mr. Risch, no. Mr. Cassidy, no. Ms. Cinema, aye. Ms. McSally, no. Ms. Stabenow, aye. Mr. Braun, no. Mr. Leahy, aye. Mr. Wicker, no. Mr. Durbin, aye. Mr. Casey. Mr. Casey. Aye. Mr. McConnell. Mr. McConnell. No. Mr. Lee. Mr. Lee. No. Mr. Sanders. Mr. Sanders. Aye. Mr. Enzi. Mr. Enzi. No. Mrs. Feinstein. Mrs. Feinstein. Aye. Ms. Rosen. Ms. Rosen. Aye. Ms. Hassan. Ms. Hassan. Aye. Ms. Baldwin. Ms. Baldwin. Aye. Ms. Collins. Ms. Collins. No. Mr. Brown. Mr. Brown. Aye. Mr. Kennedy. Mr. Kennedy. No. Mrs. Fisher. Mrs. Fisher. No.
I'm assuming.
Mr. Bozeman. Mr. Bozeman. No. Mr. Inhofe. Mr. Inhofe. No. Ms. Cortez Masto. Ms. Cortez Masto. Aye. Mr. Hawley. Mr. Hawley. No. Ms. Ernst? Ms. Ernst? No. Mr. Blunt? Mr. Blunt? No. Mr. Alexander? Mr. Alexander? No.
Adam.
Mr. Booker? Mr. Booker? Aye. Ms. Murkowski? Ms. Murkowski? No. Mr. Portman? Mr. Portman? No. Mr. Coons? Mr. Coons? Aye. Mr. Romney? Mr. Romney? No. Mr. Rounds? Mr. Rounds? No. Mr. Thune? Mr. Thune? No. Mr. Tester, aye. Mr. Warner, aye. Mr. Cardin, aye. Mr. Moran, no. Mr. Bennett, aye. Mr. Schumer, aye. Mr. Sass, no. Mr. Burr, no. Mr. Graham, no. Mr. Van Hollen, Mr. Van Hollen, aye. Mr. Murphy, Mr. Murphy, aye. Mr. Blumenthal, Mr. Blumenthal, aye. Ms. Hirono, Ms. Hirono, aye. Mr. Kramer, Mr. Kramer, no. Mr. Cruz, Mr. Cruz, no. Mr. Sullivan, no.
Are there any senators in the chamber wishing to change their vote or to vote? If not, on this vote, the yeas are 47, the nays are 51. Under the previous order requiring 60 votes for the adoption of this amendment, the amendment is not agreed to. The question occurs on the Johnson amendment. Is there a sufficient second? There appears to be. The clerk will call the roll.
Mr. Alexander, Ms. Baldwin, Mr. Barrasso, Mr. Bennett. I'll wait for the vote to come back. Mrs. Blackburn, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mr. Braun, Mr. Brown, Mr. Burr, Ms. Cantwell, Mrs. Capito, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Mr. Enzi, Ms. Ernst, Mrs. Feinstein, Mrs. Fisher, Mr. Gardner, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, nope. Mr. Graham, Mr. Grassley, Ms. Harris, Ms. Hassan, Mr. Hawley, Mr. Heinrich,
They snuck up on me. Thank you.
Ms. Hirono, Mr. Hoven, Mrs. Hyde-Smith, Mr. Inhofe, Mr. Johnson, Mr. Jones, Mr. Kane, Mr. Kennedy, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Leahy, Mr. Lee, Mrs. Loeffler, Mr. Manchin, Mr. Markey, Mr. McConnell, Ms. McSally, Mr. Menendez, Mr. Merkley, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Paul, Mr. Perdue, Mr. Peters, Mr. Portman, Mr. Reed, Mr. Risch, Mr. Roberts, Mr. Romney, Ms. Rosen, Mr. Rounds, Mr. Rubio, Mr. Sanders, Mr. Sass, Mr. Schatz, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Shelby, Ms. Sinema, Ms. Smith, Ms. Stabenow, Mr. Sullivan, Mr. Tester, Mr. Thune, Mr. Tillis, Mr. Toomey, Mr. Udall, Mr. Van Hollen, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young, Senators voting in the affirmative: Barrasso, Braun, Burr, Cassidy, Cornyn, Kramer, Cruz, Daines, Enzi, Ernst, Fisher, Inhofe, Lee, Loeffler, Moran, Perdue, Rounds, Rubio, Sass, Sullivan, and Tillis. Senators voting in the negative: Baldwin, Blumenthal, Brown, Cantwell, Cardin, Casey, Coons, Duckworth, Durbin, Feinstein, Gillibrand, Hirono, Jones, Leahy, Murphy, Murray, Smith, Stabenow, Tester, Udall, Van Hollen, Warner, and Wyden. Mr. Bennett, no. Ms. Hassan, no. Mr. Graham, aye. Mr. Young, aye. Ms. Cortez Masto, no. Mr. Paul, aye. Ms. Collins, no. Mrs. Hyde-Smith, aye. Mr. Portman, aye. Ms. Warren, no. Mr. Reed, no. Mr. Johnson, aye. Mr. Whitehouse, no. Mr. Bozeman, aye. Mr. Cotton, aye. Mr. Grassley, aye. Ms. Sinema, aye. Mr. Booker, no. Mr. Crapo, aye. Ms. Klobuchar, no. Mr. Merkley, no. Mr. Hoven, aye. Mr. Hawley, aye. Mr. Peters, no. Mr. Scott of South Carolina, aye. Mr. Kane, no. Ms. Murkowski, no. Mr. Sanders, no. Mr. Markey, no. Mr. Wicker, aye. Mr. Thune, aye. Ms. McSally, aye. Mr. McConnell, aye. Ms. Harris, no. Ms. Rosen, no. Mr. Alexander, aye. Mr. Blunt, aye. Mr. Schatz? No. Mr. Romney? No. Mrs. Blackburn, aye. But I will hear you from now. Yeah. Mrs. Shaheen, no. Mr. Risch, aye. Yeah. Mr. Kennedy, aye. Mr. King, no. Mr. Manchin, aye. Mr. Roberts, aye. Mr. Langford, aye. Mrs. Capito, aye. Mr. Carper, no. Mr. Heinrich, no. Mr. Menendez, no. Mr. Toomey? Aye. Mr. Shelby, aye. No. Mr. Schumer, no.
Does any senator in the chamber wish to change his or her vote? If not, the yeas are 50, the nays are 48. Under the previous order requiring 60 votes for the adoption of this amendment, the amendment is not agreed to. The clerk will read the title of the bill for the third time.
H.R. 6201, an act making emergency supplemental appropriations for the fiscal year ending September 30, 2020, and for other purposes.
The question occurs on passage of the bill. Is there a sufficient second? Appears to be. The clerk will call the roll.
Mr. Alexander, Ms. Baldwin, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mr. Braun, Ms. Cantwell. Mrs. Capito. Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Mr. Enzi, Ms. Ernst, Mrs. Feinstein, Mrs. Fisher, Mr. Gardner, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Ms. Harris, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Ms. Hirono, Mr. Hoven, Mrs. Hyde-Smith, Mr. Inhofe, Mr. Johnson, Mr. Jones, Mr. Kane, Mr. Kennedy, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Leahy, Mr. Lee, Mrs. Loeffler, Mr. Manchin, Mr. Markey, Mr. McConnell, Ms. McSally, Mr. Menendez, Mr. Merkley, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Paul, Mr. Perdue, Mr. Peters, Mr. Portman, Mr. Reed, Mr. Risch, Mr. Roberts, Mr. Romney, Ms. Rosen, Mr. Rounds, Mr. Rubio, Mr. Sanders, Mr. Sass, Mr. Schatz, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Shelby, Ms. Sinema, Ms. Smith, Ms. Stabenow, Mr. Sullivan, Mr. Tester, Mr. Thune, Mr. Tillis, Mr. Toomey, Mr. Udall, Mr. Van Hollen, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Baldwin, Bennett, Blunt, Bozeman, Cantwell, Cardin, Cassidy, Collins, Coons, Cotton, Kramer, Crapo, Daines, Duckworth, Gillibrand, Graham, Grassley, Hassan, Heidsmith, Kane, Kennedy, Leahy, Menendez, Murray, Perdue, Peters, Reed, Romney, Rosen, Rubio, Shaheen, Shelby, Sinema, Smith, Thune, Tillis, Warner, Warren, Wicker, Young. Mrs. Feinstein, aye. Mr. Roberts, aye. Mr. Schatz, aye. Mr. King, aye. Senators voting in the negative: Lankford, Lee, Paul, Scott of South Carolina. Ms. Cortez Masto. Ms. Cortez Masto, aye. Ms. Klobuchar. Ms. Klobuchar, aye. Mr. Hoven. Mr. Hoven, aye. Mr. Sullivan, aye. Mr. Blumenthal, aye. Mr. Wyden, aye. Mr. Heinrich, aye. Mrs. Capito, aye. Ms. McSally. Aye. Mr. Booker, aye. Mr. Durbin, aye. Ms. Harris, aye. Ms. Stabenow, aye. Mr. Manchin, aye. Mr. Moran, aye. Mr. Whitehouse, aye. Mr. Braun, aye. Ms. Murkowski, aye. Mr. Casey, aye. Mrs. Blackburn, no. Mrs. Fisher, aye. Mr. Barrasso, aye. Mr. Burr, aye. Ms. Ernst, aye. Mr. Schumer, aye. Mr. Hawley, aye. Mr. Udall, aye. Mr. Carper, aye. Mr. Brown, aye. Mr. Jones, aye. Mr. Enzi, aye. Mr. Cornyn, aye. Mr. Rounds, aye. Mr. Inhofe. Mr. Inhofe, no. Mr. Alexander. Mr. Alexander, aye. Mr. Van Hollen. Mr. Van Hollen, aye. Mr. Sass. Mr. Sass, no. Ms. Hirono. Ms. Hirono, aye. Mrs. Leffler. Mrs. Leffler, aye. Mr. Markey. Mr. Markey, aye. Mr. Tester. Mr. Tester, aye. Mr. Johnson, Mr. Johnson, no. Mr. McConnell, Mr. McConnell, aye. Mr. Sanders, Mr. Sanders, aye. Mr. Toomey, aye. Mr. Portman, aye. Mr. Merkley, aye. Mr. Murphy, aye. Mr. Cruz. Mr. Cruz. Aye. Mr. Risch. Mr. Risch. Aye.
Is any member in the chamber wishing to vote or change their vote? Seeing none, the ayes are 90, the nays are 8. The bill is passed. Under the previous order, the motion to reconsider is considered made and laid upon the table.
Madam President,
The Majority Leader.
we just passed this bill that came over from the House. It's on the way to the President. a very important first step, which we're calling Phase 2. We'll continue to work on the next bill to respond to the crisis. And I want to repeat again, the Senate's going to stay in session until we finish Phase 3, the next bill, and send it over to the House. Republicans hope shortly to have a consolidated position along with the administration. Then we intend to sit down with our Democratic colleagues, see what we can agree to, and I would recommend senators stay around, close. Just how long it will take to get through these steps is unclear, but as everyone knows, we are moving rapidly because the situation demands it.
Madam President,
Senator from Oklahoma.
I ask unanimous consent the Senate be in a period of morning business with senators permitted to speak for up to 10 minutes each.
Without objection.
Three months ago, no one in the country, in fact, no one in the world, had heard the term COVID-19. The term coronavirus was around, but most folks didn't use that because it was connected to SARS or to MERS in the past. But in December of 2019, an infection started in China, and it spread rapidly through the Wuhan region. And by January, there were thousands of people affected before most of the world even knew it existed. Now almost every country in the world has infections. We have hundreds of thousands of people that have had contact with this virus. And unfortunately, we've lost thousands of people worldwide. In the United States, the numbers continue to increase because we're continuing to increase the number of people that we can actually test. Fortunately, the vast majority of the people who get this virus have little to no symptoms. It's a cold, it's a mild flu to them. But for our vulnerable populations, our elderly populations, those with heart issues and lung issues, smokers, diabetics, this can be a very, very serious thing. And the challenge that we face in our healthcare is that for every person that walks in to get tested, they're face-to-face with one of our healthcare workers, especially in rural areas of our state, that may be the only healthcare professional for that entire county. And if that person who has not been vaccinated as well, because there is no vaccine yet, if that person is not able to serve the rest of the population, a bad health situation becomes even worse because of diminishing care. We as Americans are taking this seriously, as we should. We're paying attention. There's a younger population that's spending time trying to be able to get away from other individuals, to be able to self-isolate, self-quarantine, to be able to get social distancing is the new term, to be able to find some way to not be close to someone else so you don't accidentally pass the virus on. Because though the virus may be within them and they're not personally, physically affected much, the effect of someone else could be pretty dramatic. So out of respect for others, to try to manage that distance and to be attentive to that. There's been multiple actions from the government over the past several months, both travel bans that we all know very much about, starting with China and now in multiple areas of the world. Lots of encouragement to be able to limit gatherings, first to 250 and then to 50 and now to 10. And now a series of just keep social distancing to be able to make sure you're aware of that. There's been emergency declarations that have been done. CMS has changed coverage to as recently as yesterday on dealing with issues like telehealth, making sure that individuals that may have other care needs don't have to actually go into a healthcare professional for their fear of who else is sitting in the waiting room, but then get access to telehealth, a much needed change. The FDA has been very aggressive in giving access to different states to be able to do their own testing regimens. CDC has been active in trying to be able to get to a point where they can get a testing system that can actually get out to the entire country. The challenge was early on, many other countries did tests and developed tests with a high false positive rate. CDC was very focused on trying to get as accurate as they possibly could. That meant it took longer, and we don't have the tests out. The tests are more accurate, but we don't have the testing numbers that we need at the moment that we needed it, which was last week. So now we're still struggling to be able to catch up on testing all over the country. Multiple other labs, multiple universities are also coming on board. In fact, it's interesting, multiple other countries are also developing their own testing processes. In the days ahead, we will be able to catch up on the testing, that any American could be able to get testing, but for now, it's limited. In states like my state in Oklahoma, where the virus is beginning its acceleration, we were late to actually get to the virus coming to Oklahoma, but now the virus is there, it starts to accelerate. And testing is exceptionally important to us, as it is to everyone else. The Department of Transportation is engaged on things like waivers for hours of service to allow the movement of goods all over the country, dealing with livestock and with food. There's been a big push from just about every retailer in the country to make sure they're cleaning facilities more and being open and accessible, doing hours early in the morning for those in the most vulnerable populations so they're not shopping with people that may have the virus and don't even know it. There's been a shift around the entire country to encourage people to telework or to be able to find ways to be able to separate out in their place of work. All of these things have occurred just in the last few months. Beginning again to say, 3 months ago, none of us knew this term or this virus existed. All this has happened extremely rapidly. 3 weeks ago, Congress and the President agreed on a proposal. It was a wide bipartisan proposal to be able to deal with additional funding for testing, additional funding for the vaccine development, additional funding for state and local departments of health to be able to make sure they're taking care of that. My own state in Oklahoma has already received almost $7 million to be able to help in what's happening in our county, and we are in desperate need of those dollars to be able to get that done. Vaccine development is already in human trials now. It's in phase 1. It will take multiple months to be able to get that done, but we have already begun that process, and that's important to us. The bill that was on the floor today dealt with multiple helpful things. It expands SNAP, what some people still call food stamps, but it's supplemental nutrition. It's assistance for those families. It's an expansion of that. It also deals with unemployment insurance benefits, be able to make sure those are staying consistent and those get extended out to people that are going to need it, because in the past week, unemployment has dramatically increased all over the country. And in the days ahead, when we'll be able to see the numbers, we'll see the difference of what's happened this week versus the week before versus the week before that. The struggle is my phones have been filled with one other element that's in that bill, and that deals with a mandate on small businesses for sick leave. Small businesses in my state are closed. Many retailers and restaurants, many small businesses are really struggling with how they're going to pay for this when they have no income coming in right now. They're hearing the promise of a federal reimbursement coming to them, but they don't know when that's coming, and they're literally teetering on the edge right now. And their struggle is, please don't do something that pushes us over the edge. We need help, but we don't need a bureaucracy that's going to be slow to respond, or a way that's actually going to get us some help, but help that comes to us too late. In these terrifying words that I've heard from multiple employers, I cannot make it with that structure. I'm going to have to lay people off and hope to be able to hire them back when this all ends. For those families that are laid off and in unemployment now, this is a very different day for them. And my fear is some of what pushed some of those individuals over the edge into unemployment was a nudge to say, we're going to add one more mandate to you at your worst possible economic moment. The first principle that we should have as a Congress is do no harm. We need to step in and help those folks that need help. Now, there's lots of ideas being bantered around right now in the Senate and the House from both sides of the aisle to try to figure out how we can get help as rapidly as we can to as many people as we can. This is a moment unlike what we have seen before, where it's not that the economy is crashing because of some economic foundation that's not there. It is fear and panic that's global, that literally we're struggling with what if, and the CDC and our own governments saying to employers, it would be best if you closed for a season. And they, being good citizens and good neighbors, quite frankly, are complying with that for fear of their own business and of their own employees. I finished my day yesterday, late last night, talking to a small business owner in Oklahoma who relayed to me what he's going through right now and the struggles that he's having keeping the doors open. And quite frankly, he was fairly blunt with me to say, the things that are being passed in the bill tomorrow will affect me, but my competitors that are big companies, it doesn't affect them. And so it's already hard enough for me as a small business to compete with them. Now I have a new mandate on me that's not a mandate on them. And it makes it even harder. And I don't think I'll have the cash flow to be able to make this work. Towards the end of the conversation, he paused and literally began to cry. And he pulled himself together and said, I'm having to call people and tell them I don't have hours for you next week. And these are people I care about. We need to take action. But we need to take action that helps people keep their jobs, helps people stay employed, and helps us deal with the dip in the economy right now to help them pull back out. My fear is we didn't do that just now. We might have just made it worse. There are important things for us to do, and many of those things we're working on this week. We have got to get help to as many people as we can, as fast as we can. And it is my hope the Senate will continue to stay in session, as the leader has already said and promised that it would, until we actually come to some proposals where we have wide bipartisan agreement that get help rapidly to people that need the help the most. Those workers, those individuals that are struggling, those folks that are hourly, those folks that are waiters and waitresses, those folks that work at the coffee shop and own the coffee shop, those folks in retail locations that are shut down. They need us to stand with them, and this is our moment to do it. Let's do it together. With that, I yield the floor.
From Massachusetts.
Thank you, Madam President. Madam President, I want to start my remarks by saying to the people of Massachusetts and families all across the country, many of you are making big sacrifices, quarantining yourselves, postponing or canceling major events, dealing with closed schools and daycare. We are grateful. Right now, our primary goal needs to be to slow the spread of this virus. And we all share in that responsibility. And so we thank you for everything you are doing to keep your loved ones and everyone else's loved ones safe at this time. We are at war with the coronavirus, and we need a massive wartime manufacturing mobilization for coronavirus testing kits and personal protective equipment for medical personnel and emergency responders. That is why last weekend I was the first to call on President Trump to immediately use existing authorities under the Defense Production Act to bring all of the power of the federal government to bear in mobilizing industry to meet this crisis. It's why I had authored the Senate resolution calling on him to do so. And it's why I spoke directly to Vice President Pence yesterday to urge the administration to take this critical action. And I am glad that they are doing so. The Defense Production Act allows the federal government to direct supplies of critical materials and equipment that our hospitals and first responders need. It allows us to mobilize industry to expand production and gives us the power to coordinate industry to respond to this crisis. We need to fully use all of those powers that are provided under this law. And that is why I am so glad that President Trump has today invoked the power of the Defense Production Act to respond to the coronavirus crisis. I'm glad that he is exercising it. And I'm glad that after my conversation yesterday with Vice President Pence, that they decided to put this on the agenda for our country. We need to massively increase private production of the life-saving personal protective equipment, medical supplies and devices, and diagnostic testing supplies we need to combat this viral enemy. We need to activate our capable and talented domestic industry and bring the full weight of the federal government behind this effort. We are talking about gowns and gloves and face shields and surgical masks, N95 respirators, ventilators, disinfectant wipes, and hand sanitizers. And we do not have nearly enough of this life-saving equipment. For instance, the United States Department of Health and Human Services estimates that the United States could need up to 3.5 billion respirator masks. Let me say that again. Our own Department of Health and Human Services says that we could need upwards of 3.5 billion respirator masks, but our strategic national stockpile, the country's emergency medical supply bank, holds only a tiny fraction of that, just 12 million respirator masks. Not 3.5 billion, 12 million. The medical community calls this personal protective equipment PPE. But PPE also stands for a promise to protect everyone. And this is the promise we should make and keep for our hospital personnel, first responders, and patients. Invoking the powers of the Defense Production Act will help ensure that we can keep this promise to our American heroes who are on the front lines of battling this epidemic. I've been in regular contact with the Massachusetts Health and Hospital Association and the Massachusetts Nurses Association, and both have issued a terrible alarm. There is insufficient medical equipment and supplies to test and treat affected individuals and protect healthcare workers and first responders. For example, the Berkshire Hospital told me that they require 3,500 respirator masks a day. That's 35,000 in just 10 days for the Berkshire Hospital out in the least populated part of our state, for just that one smaller hospital. Yet the entire state of Massachusetts recently received only 70,000 of these respirator masks. That is not nearly enough. We do not want our nurses and our doctors reusing or rationing masks. Additionally, hospitals and labs across the nation are trying to ramp up testing capacity but face shortages in test kits and supplies. But we need to dramatically scale up testing and ensure our continued ability to test. Our nation must be able to conduct tens or hundreds of thousands of tests daily, ultimately testing millions of people over the course of our response. That means producing swabs, which we are now running short of, and other testing materials. We have used the Defense Production Act before, during the Korean War, to mobilize defense infrastructure, and during the Cold War. And make no mistake, we are facing an equally deadly enemy in this virus, and we need to bring all of our authority and resources to bear to defeat it. All of us owe a debt of gratitude to our frontline health and medical care workforce. They don't have a roadmap for what is happening right now. It's unprecedented. They just have skills, a commitment, and the hearts of heroes, and we owe them the resources they need to be protected in order to do their jobs. Sadly, this pandemic is going to get worse before it gets better. I had been calling upon the President to declare a national emergency, which he finally did last week. Now that he has done so, we need Massachusetts to get all of the funding that is due. I have been in regular contact with Governor Baker and Mayor Walsh, and I will support his requests, their requests, for federal resources. As the Senate works on an economic relief package that matches the scale of this crisis, we need to ensure that we put people and family first. No half measures, no hidden bailouts and giveaways, just to big corporations. Paid sick time for all workers, unemployment insurance for all workers, including for tip workers, gig workers, contractors, home workers, expansion of SNAP and WIC and school lunches and other food security programs. No evictions, no cutting off of utilities, no cutting off of Wi-Fi, halting all deportations and releasing of detained immigrants who pose no threat to public safety. Provide free Wi-Fi to low-income households with students who cannot afford it but are going to be at home because of school closures, so that we don't have a huge homework gap that now explodes in our country as poorer children don't have access to the Wi-Fi technology at home so that they can learn at the same pace that kids who just happen to live in wealthier families will have. We cannot allow that to happen. These kids should be able to learn at home regardless of their income. We need free Wi-Fi for those kids. We have to reimburse our states and cities and tribes. They are bearing the brunt of this crisis, and they need resources immediately. My commitment to protecting the health professionals, to ensuring that consumers and workers and families of Massachusetts get relief from the impacts of the coronavirus is my #1 priority. We have to protect the small businesses in our country. We have to make sure that they receive the resources which they need. Millions and millions of small businesses right now are feeling enormous stress. We have to make it possible for them to be able to receive the relief which they need, the help which they need in order to survive, and we have to put up front whatever the capacity is to make sure that they get the resources which they need. Because if that system in our country, where 48% of all workers are employed, small businesses in our country, and they are living on the margin, then we are going to have an economic catastrophe by August or September where millions of these small businesses will just declare bankruptcy. That's just the bottom line economic fact of the matter. We have to give them the help, and we have to make sure we have the resources inside of the federal government, the personnel, that will ensure that we can deliver that relief to them. So, to the people of Massachusetts, I want you to know that I am here for you, and I will help any of you individually who need any assistance during this emergency. This current moment may call for distancing and isolation, but we cannot and should not sever our basic human connections to one another because we are all in this together. And I want to end with the most important reminder. We must continue to listen to the guidance of scientists and medical professionals. This pandemic is unprecedented. It will require an unprecedented mobilization and response at every level of society. We can get through this, but it will require a commitment from every single one of us. We are one big family in the United States. Many families are going to be suffering, and it's going to be our job to make sure that we protect those families. And it's the job of this institution to do so. We are the legislative first responders. We are the ones that have to provide the resources that then allows the first responders, the families in every community across our country to have the resources to help everyone in our society. That's our goal. A pandemic should know no partisanship. Let us come together and produce the big package that our country right now so desperately needs. Madam President, with that, I yield back.
Madam President.
Senator from Kansas.
Madam President, thank you very much. This has been a trying and difficult, challenging time in our country, in my home state of Kansas. Lots of conversations, care, and compassion going on. We can't give anybody a hug these days. We can't extend a hand, at least literally, but we are extending a hand to all of our friends and our neighbors, those across our community, those across our state, and across the country. I'm troubled, of course, by what circumstances Americans find themselves in. And there are those who are poorly in a poor circumstance in which they can recover from the circumstances that we face. I want to make sure that Kansans know that we hear their cries, we know of their problems, and that work is afoot to try to make a difference. Just a couple of examples, things that perhaps in the overall scale of where we are, perhaps don't seem significant enough, but can make a difference in individual lives and families' well-being. We've been successful to this point in getting the school lunch program available for students whose schools are no longer in session, who don't go to the classroom and therefore aren't in the school lunchroom. And USDA and the school food program are now available for those who are at home because their school classes have been canceled as a result of the virus. We're paying a lot of attention, as I hope Kansans know, Americans know, to the veteran and the veteran community. And we've had success in passing legislation on the Senate floor, waiting for House consideration that would allow those veterans who are no longer in the classroom in a university or in a technical college and are now learning by distance education, by technology, to be able to continue to receive their GI educational benefits. That required a change in the law, and it's in the works so that those benefits continue, even though the student is not, as now required, in a classroom itself. We're trying to make certain that the Department of Veterans Affairs has the resources necessary to meet the needs of our veterans. It is a vulnerable population because of age and existing condition of many of our veterans. And we are in constant contact not only with the Department of Veterans Affairs, but with veterans themselves and with our veteran hospitals and clinics and other healthcare providers in Kansas. Today, we are dealing with economic relief for those who are losing their job, fearful of losing their job, or have already lost their job. Much of life's meaning comes from our employment, from what we do. And a job is certainly something that helps put food on a family's table and provides some security for an individual, but it also provides meaning, and no one can understand unless they are without a job how devastating that can be. I'm pleased by the number of businessmen and women who have called me to tell me the last thing they want to do is lay off anyone who works in their business. The circumstances at home in Kansas, we've been through economic difficulties before. We've seen the cycle of the economy, the ups and downs, the normal flows, but this is something totally different than that. Oil and gas. The price of oil is such that keeping our oil and gas producers in Kansas in business is a real challenge. Aviation manufacturing is an important component of the Kansas economy, and today, Textron Industries, which manufactures Cessna aircraft and Beechcraft, announced they are furloughing 7,000 of their 9,000 workers. That's on top of other challenges in the aviation industry, in which Spirit Aerosystems, headquartered in Kansas, has already laid off 2,800 employees. So from the oil and gas industry of western and south central and eastern Kansas to the manufacturing hub of Wichita and south central Kansas, the consequences of the coronavirus are real and felt in the pocketbook, felt in the brain and felt in the heart. Our restaurants, hotels, our car rental agencies, those who serve others. I've been in circumstances this week in visiting with a person who works, the people who work at a restaurant, the people who work at a cafe, the people who work here in Washington, D.C. at the cafeteria where I had breakfast this morning. Those who have jobs wonder if they're going to have jobs tomorrow. And those that have already lost their jobs wonder how they're going to pay the bills. This morning, a conversation with an optometrist telling me the circumstances of no longer being able to care for patients except in the emergency setting, which means that the business in the optometrist office, an important healthcare provider, the business in the dental office, that has been curtailed, and the necessity of considering laying off the clinical workers there is front and center in that conversation. It's a troublesome situation across Kansas. Doesn't matter what city or town you live in. If you're a farmer, the cattle prices today significantly depressed, despite the fact that it's still pretty expensive at the grocery store. I think about my hometown and the loss of a business. There aren't many businesses in many rural communities of Kansas. And many businesses don't really earn much of a living or a profit. It could be a family circumstance. It could be this is what they did, this is what their parents did. This could be a service to the community, and they live on a lot less because that business is important to a small community. But this kind of challenge is such that if that business closes, the chances are that it doesn't reopen. The financial circumstances of small-town America are such that there's little likelihood of recovery and reopening. I hope that the legislation that we passed today, that's now on its way to the President, it included a few things that I was troubled by and think will create significant difficulties for some. We need to continue to work to change those provisions that are troublesome and cause problems. But it was important, in my view, to make certain that the things that were wrong in that bill didn't prevent us from passing something to help those with the things that are right. None of our economic efforts that we make to make certain that people feel more secure economically will work until they feel more secure in the health and well-being of themselves and their families. So even though you may get some assistance, a person may get some assistance, a family may be relieved of some of the financial burdens that they now face, a laid-off worker may get unemployment benefits, but your mind is always going to be on the issue of your health and the well-being of your children and your parents and your grandparents, those we know in the nursing home and those we know in the nursery. And as long as we are troubled by what may happen to us in our health, no amount of economic stimulus can overcome the fear of one's well-being, and particularly the well-being of their spouse, their children, and their parents. So clearly, economic relief in and of itself, in my view, is insufficient. We need to make certain that our health care providers have the necessary tools to meet the health care needs of American citizens. And front and center in that regard is testing. And we are woefully inadequate and undersupplied in what we need to test the necessary number of Kansans and Americans to know what they face and to know what their circumstances are and to respond in the medically required way. We're working to make sure there are more tests across the country and working to make certain that those tests are distributed in a way that Kansans, their health care providers, can access them. And most recently, we were successful in getting CDC to undo a problem that kept tests from being transferred to the Kansas Department of Health and Environment in my home state. We've been pleased to see that the FDA, for example, has modified the necessary steps it takes for a manufacturer of these test kits to be certified, to be qualified to manufacture them. And the amount of test kits that are being produced, the amount of manufacturing has increased, and we're expecting significant improvements in the next couple of weeks. Yes, I wish they were here earlier, but can we fix the problem we face now and get them here soon, immediately? I sat in the desk of Senator Bob Dole, a predecessor of mine in Kansas. His name is etched in this desk drawer, now known for his bipartisanship and held in great respect not only at home in Kansas but across the country. I stand at the desk that is here in the place of Senator John McCain, two people who demonstrated the desire to work together. And while I've outlined a few things that I think are important and I wanted Kansans to know, my mission in my remarks today may be the most important, is to ask my Republican colleagues and my Democrat colleagues to set aside the usual bickering and political posturing that takes place in the United States Congress. No American can feel well, no American can feel that things are going to be okay if they don't see leadership and cooperation among us. And so while we today are preparing for the presentation of new legislation dealing with the challenges that businesses, employers, and employees face, trying to relieve the economic and financial burden that many Americans are experiencing and more will experience in the future, Could Americans please see that me and my colleagues are taking every step not to make this a political exercise, but to demonstrate our care and concern for those we represent. I mentioned a moment ago about veterans. This is the point in time in which, if you take a walk on the National Mall, as I've often done, to walk to the Lincoln Memorial, I will walk by now the World War II Memorial, I will walk by the Vietnam Wall, and on my return, I will walk by the Korean War Memorial. We should hold those veterans, those military men and women who are honored in those settings, as our role models. We should do that every day, but could we please do it over the next few weeks, the next few months, and into the next year as we try to address the challenges that America faces today? No person memorialized in those settings fought and sacrificed their life for a Republican or for a Democrat. They sacrificed because they believed they could make life better for the folks back home, their own family members, their neighbors, and people they didn't know. They sacrificed because they believed they could make the world a more safe and secure place. And I pledge myself in every way possible to see that I do the things today, tomorrow, and into the future that mean that this Congress has come together on behalf of the American people, just like those who served our country did, and now rest in peace. To the Democrat colleagues here in the Senate, please consider me open to their suggestions. And to my Republican colleagues, please know that I'm an ally in the things that we believe in. But we all may need to give a little so that America can return. Americans can be safe, Americans can be secure, our health is protected, and our economy flourishing. I would ask God in this circumstances to bless this country, to bring us together, hold us in His arms in a way that we can't do today, and to make certain that this Congress represents the will of the people, not the will of any political party. Madam President, I yield the floor.
Madam President.
Senator from Tennessee,
Thank you, Madam President. I ask consent to speak for as much time as I may require.
without objection.
Thank you, Madam President. I want to congratulate the senator from Kansas on his eloquent remarks expressing the feelings, certainly mine and those, I believe, of virtually every member of this body, that we are here not as Democrats or Republicans, but to work together to do whatever we can to address the concerns that are literally unprecedented. This is an unprecedented time in our country. I cannot remember a time in my life or in our history when the government has literally closed down the country in order to contain a disease. That's literally what we're doing, whether it's the federal government by its travel restrictions, or whether it's the state governments suggesting that schools be closed, or whether it's mayors saying that restaurants must be closed. We are closing down the country to contain a disease. Madam President, because the government is doing that on behalf of all of the people, we're going to have to pay the cost of closing down the country to contain this disease. Today, the news is that the auto industry across the country is closing down, at least temporarily. There are layoffs. I've watched over the last 40 years as Tennessee has gone from almost no auto jobs to proudly calling itself, in many ways, the #1 auto state. 140,000 Tennesseans work in auto jobs in Tennessee. That's 1/3 of all of our manufacturing jobs. They're spread through 88 counties. And over these 40 years, as textiles and other industries moved away from the United States and out of our state, the auto companies moved in virtually into every county, and our family incomes went up. So if we are in many ways the #1 auto state, then we are the #1 state to be hurt when the auto plants begin to close. We are also hurt as are citizens in every state, when the restaurants shut down. 15 million Americans work in restaurants. One of our largest industries, if not our largest industry. Almost all of those workers are being laid off in Tennessee and in many other places in the country, and even more will be. And not all of those affected are working for big auto companies or medium-sized restaurants. I received an email yesterday from friends in Tennessee who run a kennel. Well, you may say that's not so important. Well, it is important to a lot of us. They say we're suffering a massive drop-off in our business as a result of the coronavirus. I fear we may have to close our doors for a month or two, hopefully not that long, as our wonderful customers are forced to curtail travel. I'm currently trying to secure around $50,000 in loans to supplement our dwindling reserves to see us through until May or June. I'm currently applying for an SBA disaster relief. This precipitous drop in business comes on the heels of a major flood damage to our fencing caused by the recent floods. Our flood insurance refuses to cover that. We're not seeking charity, just a business loan for $30,000 to $50,000 to secure our business until it passes. We always pay our way. This couple has 2 young children and maybe a couple of employees in their kennel. They're awfully good people. They're salt of the earth Tennesseans. They're like many Americans who are suddenly confronted with this disease that just came out of the blue and has caused our government to shut our country down. Now, what shall we do about it? Well, a couple of weeks ago, Congress reacted and the President with $8.3 billion to help beef up our public health system. We have the best public health system in the world, and we wanted to help it get started. Today, we've passed a bill that some people have estimated at $100 billion, which includes a whole variety of other steps from Democrats and Republicans. That includes encouraging more testing, that creates a new system of paid leave for businesses of less than 500 employees and family leave. And as Senator McConnell said, we're going to stay here this week until we take step 3. And step 3, according to the President's proposal, would include direct financial payments to Americans. It would include support for essential businesses that need stabilization, like the airlines. And it would include loans to small businesses so that they could keep their employees working. Perhaps that proposal would be good for that small kennel that I talked about. That is said perhaps to cost another $1 trillion. $1 trillion is a lot of money, even in the United States. Our gross domestic product is about $22.3 trillion. We have 25% of all the money in the world in this country just for 5% of the people. But the idea that we would have to spend $1 trillion or more to contain a disease would be unthinkable a few weeks ago. But what we've learned very quickly is we're going to have to pay the cost of containing the disease, because the way we're containing it is that the government is shutting down major parts of our economy. And I don't believe that what we do today or what we propose to do later in the week will be enough. Because as I look at the number of people being laid off in this country, our state unemployment agencies are not going to be able to deal with that. In Tennessee, for example, where unemployment has been very low and where people have found it easy to find a job, there were only 2,000 applications for unemployment insurance last week, but already this week, by 2 p.m. on Wednesday in the middle of the week, there were 4 times that many applications, 9,177. And if you're successful in unemployment compensation in our state, you get $275 per week for 26 weeks. So we're going to have to do even more than the Congress has done, even more than the President has done. And I think we have to recognize that the president was wise on January 31st when we only had 6 cases of coronavirus detected in the United States to impose the strictest travel bans on people coming into our country in 50 years. Dr. Fauci, who all of us respect, said if he hadn't done that, we'd have many more cases today. But still, we have a disease that's causing the governments, this one, the state government, the local government, to shut major parts of our economy down. That's why I voted today for the legislation that was phase 2 in our effort to respond to that. Even though I have significant issues with the sick leave and family leave proposals that are part of it, I believe those provisions, while well-intended by the administration and by the House of Representatives, will hurt many employers and will shortchange many employees. First, to be fair, I want to try to make sure that what the Treasury intends to do is on the record. I've had several conversations with the Secretary of the Treasury and with other officials to ask them just what they intended to do and to list the problems that I had. So here's what they say, and what I'm doing is characterizing the conversations and the writings that we have had. They pointed out that what many businesses have read is in this bill was what was in the draft of it that the House passed on Friday before technical corrections were made over the weekend, and that the technical corrections greatly improved the bill from the point of view of employers. This is what the Treasury Department says. Under the legislation, employers receive a dollar-for-dollar refundable tax credit for the COVID-19 related sick and family leave payments made to their employees. As amended, they mean the technical corrections over the weekend, the credit is carefully calibrated, in the Treasury's words, to ensure there is no sick or family leave requirement in excess of the credit. The legislation now also includes explicit grants of regulatory authority to both the Secretary of Labor and the Secretary of Treasury to ensure consistency between the leave requirements and the credit provisions. In addition, and this is what the Treasury officials have been saying to us over the last few days, the legislation now provides that the sick and family leave payments are not considered wages for employment tax purposes. The legislation now extends the employer credit to include costs for maintenance of health benefits paid by the employer while employees are on leave. Lastly, the Treasury and the Internal Revenue Service are considering options to provide an advance payment for the refundable credit to ease any tax flow burden that a small fraction of employers may experience. I'll have more to say about that in a minute, but what that means in plain English, they're considering a way to make sure that before the employer has to pay this required family leave to an employee, that the federal government has given the money to the employer. Besides this, the legislation now includes an explicit grant of authority, Treasury says, to the Secretary of Labor to exempt small businesses from the only long-term leave requirements it contains where those requirements would result in financial hardship. And then the Treasury, in their conversations with me and in the writings that they've sent out, make the argument that far from imposing special burdens, the net effect of this legislation is to provide an important benefit, given that many already provide sick leave and that many more will need to do so in response to the COVID-19 outbreak. Moreover, by structuring coverage for paid sick leave as a credit, the legislation ensures that employers generally receive relief immediately rather than having to wait for a refund. In the event the amount of the credit exceeds an employer's tax liability, the credit is made refundable to ensure that the employer is fully compensated for all payments made under the leave requirements. And the Treasury goes on to say, Treasury and IRS are working on options to provide an advance payment of the credit to get cash in the pockets of small businesses and their employees immediately. The intent of the legislation, the Treasury argues, is to fully fund the payments employers make to their employees who experience employment interruptions related to COVID-19. In summary, the amended legislation does not require employers, according to the Department of Treasury,
to make payments in excess of amounts eligible for the refundable tax credit, nor does it require employers to pay employment taxes on those amounts. To the contrary, it provides an important and immediate benefit to small business and their employees for whom financial assistance is needed as quickly as possible. That is the argument of the Secretary of the Treasury and his subordinates in conversations with many of us over the last few days. That is their intention. Now, I read that in detail because in the Dakotas and in Tennessee and in many places all across this country, there are about, if my figures are right, about 6 million businesses that could be affected by this mandate that employ 51 million employees, or at least they did employ 51 million employees until all of the problems created by this virus. Now, having tried to be fair and given you what I understand the Treasury's intention to be, which I think will be useful to the owners of small business, to their accountants, and to their lawyers who are trying to figure out the law that was passed today. Here are my problems with it. Number one, I'm not sure the Treasury can live up to its promise to make sure that the employer has the money from the federal government before the employer has to pay the sick leave to the employee. Now, here's my principle. I think sick leave and family leave in these circumstances is a good idea. I mean, if someone's quarantined for 2 weeks, I think all of us should have to pay the cost of that. And for another 10 weeks, some of the cost of the medical and family leave. I buy that. I can support that. But I believe if Washington, D.C. is going to require it, Washington, D.C. should pay for it. If Washington, D.C. is going to require a small business, many of which are struggling, many of which are going out of business, to pay a new mandate, Washington should pay for it. This is no time to be imposing on small businesses an expensive new mandate or unexpected new cost when they have money, they don't have money coming in to pay for the normal costs that they have. Now, I know that it is the goal of the Secretary to let it work this way, because he's told me this, he's told all of us this, he said it in public, he put out a statement. Under the sick leave proposal, every couple of weeks, a businessman will put aside enough money for withholding and Social Security taxes. That adds up to about 15% of salary of an employee. What the Treasury is saying is that the employer can use that money, instead of setting it aside for the government, you can use it to pay sick leave. Well, there are two problems with that. One is I don't like the idea of the employer using the employee's tax money. You usually get in trouble for that. If I set aside the senator from the Dakotas tax payment and then I use it for some purpose, you can go to jail for that in some cases. At least it's inappropriate. So I'm uncomfortable with that, which means that the business might only have 7.5% of the salary set aside for that purpose. But even if it's 15%, I'm not sure it's enough. Well, the Treasury Secretary said, we understand that, so we'll allow advance payment, and we hope that we can come up with a system that would get it there immediately. He hasn't promised that it would come in one day, but his objective, I'm sure, if he were here on the Senate floor, would say, I'd like to get it there the same day. Well, wanting to get it there the same day and getting it there are two different things. And if I'm a small business person in Tennessee and I know that I'm going to have to cut a payroll check on Monday and that I have no money coming in to pay for it, and there's not enough money in my escrow account to pay for it, I want my money from the federal government before I cut the check. And so, Mr. President, I intend to try to amend the legislation that we passed this weekend to say that with sick leave and paid family leave, since Washington is requiring it and Washington is paying for it, then Washington will need to make sure the employer has the money before the employer has to pay the check. That's number one. Number two, I want to make sure that the employer doesn't have to pay more on sick leave than the federal government cap. There's a cap, I think it's about $132,000 annualized pay on sick leave, and if an employee makes more than that, that employee is going to have to take a pay cut, or she might use the private right of action to sue the employer to say, I want you to pay the gap between $132,000 and whatever I made. Well, you may say, I'm not too sympathetic to the employee who makes that much money. I'm not talking about being sympathetic to the employee. I'm talking about being sympathetic to the employer who may not have any money. Remember, this is a Washington mandate, and Washington should pay for it. Now, the Treasury Department has amended through technical changes this past weekend. They said so in the information I just read. They've amended the bill to try to make that clear, and I hope that is successful. Third, layoffs. I mentioned the restaurant industry. There are 15 million people who work in the restaurant industry. If they're not laid off now, they're going to be mostly all laid off before very long. And unfortunately, Mr. President, none of those men and women who've been laid off are eligible for this sick leave, because you're going to have to work for 30 days for this small business, this company with less than 500 employees, in order to be eligible for the paid sick leave. So I'm afraid as a result of this, many employers worried about this provision may have an incentive to lay off more of their employees. But the truth is, they don't need much more incentive, because you're a restaurant and you've been told by the local health board to close down. You don't have any money coming in. You can't pay your employees anyway, and so you don't have any choice. But my point is that this is a very limited benefit in the restaurant industry, and probably in many other industries, because it does not help the laid off employee. And finally, there's been a lot said that, well, for the smallest companies, those with less than 50, that you can apply to the Secretary of Labor and he'll make you exempt from the mandate. Well, I think that's a good idea, because that's the small mom and pop diner, that might be the kennel that I just talked about that might have 3 or 4 employees. They're not accustomed to dealing with all of this Washington legalese and requirements and regulations. They're not geared up for that. But as I read the language in the law, it's a much narrower exception than that. And so I'm going to attempt to amend the law that passed today to broaden the exception so the Secretary of Labor has more authority to waive the mandate for businesses with less than 50. So as I said, Mr. President, there are a number of important benefits in the bill we passed today, especially on testing. We've seen a great increase in the number of available tests over the last few weeks. The governor of Tennessee said yesterday that we have sufficient testing. Well, that's for today, maybe not for tomorrow or the next day. One of the greatest steps forward has been to finally allow commercial testing to be used. I mean, why shouldn't the Mayo Clinic be able to go ahead, or Cleveland Clinic be able to go ahead and develop a test and move ahead with it? So now that they can. But while we've done a great deal, there's a great deal more that we must do. I'm convinced that even if we do, as Senator McConnell has said, and pass our Phase 3 legislation this weekend, which would include loans to small businesses, direct payments to individuals, stabilizing payments to automobiles, to airlines, for example, and maybe other industries, that there's more to do. And my guess is that the next step after that, Phase 4, let's call it, is to look to our state employment compensation systems and make sure that they're able to handle the large number of people who are losing their job because the government is shutting down the economy in order to contain the disease. I voted for the Johnson Amendment today to the bill that I later voted for because I thought it was headed in the right direction. Rather than Washington issuing mandates, I would rather Washington work with the states in an existing program make sure states have sufficient funding on top of their own funds to deal with a large number of auto workers, restaurant workers, and workers at the small kennel with 2 or 3 employees. Make sure that they have sufficient funds, and I believe in addition to that, the figure in the weekly fund is going to have to be higher than the $327 that it is in Tennessee. This is unprecedented. We're closing down the economy in order to contain the disease, and because we're doing that, we governments at all levels, we're going to have to pay the bill. I thank the President. I yield the floor.
President,
Senator from Delaware.
Mr. President, the Senate of the United States has just acted, has taken up and passed a roughly $104 billion package of assistance that is going out to American families, American workers, to our healthcare system, to our states and our communities. And I just wanted to take a few minutes and talk about this important step we've just taken and where we have to go next. The Delawareans I've heard from today and this week, this month, are worried. They're anxious. They've been up all night. They're trying to figure out how they're going to care for their children who are home from school and need support and instruction and education, how they're going to care for their parents who are vulnerable and elderly and sick and are concerned about our hospitals and our healthcare system and its capacity. They're anxious because their frontline workers, their first responders, their volunteer firefighters, nurses, and orderlies who are exposed every day and concerned, they are just average citizens asking, how can I get a test and where? I've heard from the presidents of our major universities, the head of our hospital system, our governor, my colleagues in our congressional delegation. We've talked repeatedly to our director of public health, our secretary of health and human services, and I've heard from business owners, large and small, who run everything from coffee shops and diners to restaurants and hotels in our state. There is a lot of anxiety and concern. The folks of my state want to know that we here in Washington are going to put the partisan bickering aside, find answers, and get resources out to deal with this significant public health emergency. And so I hope folks take some encouragement from today's action. It passed 90-8. Very little, Mr. President, passes in this Senate 90-8. And I have very rarely seen a bill of this size, scope, and magnitude that goes from an idea to bill text to enactment in such a short period of time. But this moment demands it. Let me talk through also the priorities that are reflected in the Families First Coronavirus Response Act, because the name reflects the priorities. Hubert Humphrey, who was a former leader in the United States and our political community and system, once said, "The moral test of our government is how it treats those who are in the dawn of life, children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the disabled." And I'm pleased that the package just passed here in the Senate takes important strides to take care of exactly those folks. Children home from school who need support for learning remotely, and those in particular who rely on school lunch programs for their one good, stable, healthy meal a day will be able to continue to get school lunches delivered, either through their schools or at home. There's significant resources in this bill for that. Those who are on the front lines of this crisis, the individuals who are cleaning offices and cleaning hospital rooms and cleaning Amtrak cars and public buses, those who are putting themselves directly at risk by cleaning the spaces we all count on for our society. Frontline workers, people who are in our first responder community, people who are working in our hospital emergency rooms, this provides support for them. And for anyone who is concerned about the cost of access to testing, this bill makes clear that testing for COVID-19, for this dreaded disease caused by the novel coronavirus, will have a test for free, including those without health insurance. There's some big pieces in this bill I'll briefly mention. Paid emergency leave for workers at companies below 500 employees for 2 weeks of sick leave and up to 10 weeks of additional paid family and medical leave. We just had a disagreement over exactly how that's going to get paid for and how it's going to get compensated and on what timeline. And we are going to work out those details. My office's website will have an accessible, readable summary of what's in this bill up later tonight. The larger point was that we thought it essential that folks who we want to stay home, but who may be living paycheck to paycheck, know that they will get paid sick leave so they can stay home and we can slow the spread of this disease. There's also an increase in funds from the federal government to states for Medicaid, because a lot of our states are going to see increased costs as folks move to Medicaid as the place they get health care as they move to unemployment. $100 million in additional resources will go to the state of Delaware alone to provide support for those who may be newly dependent on Medicaid. And then last is an expansion of unemployment benefits, 26 weeks of unemployment benefits, including temporary unemployment caused because of COVID-19. There's more details to how this temporary unemployment insurance will work, but it will last longer and have a higher level of benefit and be more flexible than previous versions of federal unemployment insurance, and it's being delivered in partnership with states. So that's the biggest pieces of this bill. It's just $104 billion. But the bill we are already hard at work on will be an order of magnitude greater, likely more than $1 trillion. And if what we've seen in terms of anxiety and concern from families up and down my state and all over our country is any indication, we must take this up quickly and enact it. Small business owners I've heard from today who want to keep employing the folks who work for them but have lost half their business since our governor took the bold and necessary step of closing our restaurants and bars to all except drive-through and delivery service. That's 10% of the folks who work in Delaware work in restaurants and hospitality. Folks who want to keep their people on payroll but have no work for them to do face a very hard choice. And we need to find ways that we can both defer the payments that are necessary for students, for homeowners, for businesses, those who have outstanding payments on SBA loans or on federally guaranteed mortgages or on bank loans where we can work out some way to provide temporary relief, and then individual payments that will help students, that will help heads of households, that will help individuals. So there's a lot of different pieces that are being debated and discussed here in the Senate. Support for Amtrak, a priority for me because I commute by Amtrak and it is one of the biggest modes of transportation on the East Coast. Support for the airline and hospitality industries because they employ hundreds of thousands of people and have seen their business drop off sharply. Support for long-term structural changes to how we provide access to health care, access to skills and training for our workforce, access to higher education. I've heard very concerning stories from the folks who lead some of the most important nonprofit and faith and educational institutions in my state, and they are looking to us for bold and decisive leadership. Last, we must not forget those on the margins of our society, people who are homeless, people who are incarcerated, people who are uninsured, people who are undocumented. If we want to make sure that we make our country safe, we need to practice not just good hygiene, not just social distancing, but we need to refrain from moral distancing. We need to remember the words of Hubert Humphrey, and we need to be reminded that exactly why people look to this federal government for prompt action and for significant resources is because they look for us to be able to make sure that we see all Americans and that we know that we are all in this together. Thank you, Mr. President. With that, I yield the floor. And suggest the absence of a quorum.
Clerk will call the roll. Mr. Alexander.
Mr. President,
Senator from Tennessee,
I ask that we waive the quorum call.
without objection.
Thank you, Mr. President. I have so appreciated the comments of my colleagues today as they've come to the floor and they've talked about how they're approaching what is happening with this coronavirus pandemic and what they're hearing from the citizens of their state. And I know that each of us are spending our day listening to people in our states, listening to their concerns, and hearing them say, as you look at how you're going to address this, don't forget about us. Don't forget about us. Whether it is independent contractors that are working in the music industry, or television producers. I was talking to one last night, they've lost $9,000 worth of production work this week. Or theme park owners who are trying to figure out how they're going to work through this, or the CEO of one of our nation's airlines earlier today. People are looking to us to make certain that we address this situation in a way that is going to stabilize it and that is going to provide assistance. So as we have worked through this, one of the things I think sometimes is just a really good thing to do is to stop and kind of take stock of where you are and how is going to be best to move forward. Now, I think it's important to realize that we have already directed resources to the coronavirus pandemic. There is the coronavirus supplemental that was an $8.3 billion piece of legislation. That may seem like a lifetime ago to some of those in our state. It was a couple of weeks ago, and that money is already making its way out. Tennessee received $10 million this week in order to work on public health needs around the coronavirus. We also had our president move forward without hesitation to do the National Emergency Declaration. That freed up $50 billion of resources, money that is going to our states and our localities to help with the response for this, to get those resources where they need to go. And of course, there was legislation that passed today, and in that I supported the Johnson Amendment. I do fully believe that working through this with our unemployment insurance and our employment security system is the way to go. I've supported the payroll tax holiday. I'm one of those that has always said, why should we have to pay the government to hire somebody? And so the payroll tax holiday made sense to me. The Johnson Amendment that I co-sponsored makes sense to me, that we would do it because you can more quickly get resources to individuals from the federal government to the taxpayer, to the individual. And that is what we need to do at this time. Tennessee is very blessed. We have had a very low unemployment rate. But what we have seen in the past 2 or 3 weeks is that unemployment claims have quadrupled. And we expect that this is going to continue as workers and independent contractors and sole proprietors and small businesses see their income stream, their revenue stream, go from something healthy to zero. And Mr. President, that has happened literally overnight, just within a few days, as the economy started to shut down. And what we hear from people is, look, this is not something we have done. It is something that has been done to us. And we're being asked to close our doors and to change the way we operate. So they repeatedly say, don't forget about us, and do not give us mandates that we cannot afford, because what we need is assistance to bridge that gap. Now, when we talk about mandates that you can't afford, Tennesseans are very concerned about the paid family leave provisions that were in the legislation today. What I have heard repeatedly, whether it is someone that runs a nursing staffing company or a furniture store or a small manufacturing company, is the tax credit provision is not going to work with cash flow. And they mention this repeatedly. So my hope is that we can come together in a bipartisan basis and we can address the concerns that are there around that, because we want our small businesses to keep those doors open and to return to health and vitality. And we need to listen to what they're saying, which is help to stabilize, assist us, and help us bridge this divide so that we can come back. We also need to be listening to our nonprofits that are saying the same thing about the family leave provisions and their concerns that are there. And you know, Mr. President, we have to bear in mind all of these employers really care for and value their employees. They want to do right by them. They want to do right by their communities, and certainly they want to do right by the country. But they need our listening ears and they need our attention. Another thing that has come up that is of concern that was in the legislation that cleared the chamber today is the Medicaid provisions, the Medicaid expansion provisions, the way it affects the non-expansion states. And it adversely impacts states like Tennessee that were non-expansion states. And there are some definitional changes that need to be made in that provision so that we are not adversely impacting these states. You know, and our Tennessee business owners and employers, for them, this is a very tedious time. It's an emotional time for them. I talked with an employer last night who laid off 20 people out of a small business. And they had to do it in order to keep the doors open. But what they all tell me is that they are really very grateful that the president, the vice president, and the task force are focused on getting the virus under control, getting the response from our country under control, and making certain that we address the economic and financial impact on this. They know that it's going to be a long way back on this one, that there isn't a quick fix, and they realize that the way this all happened had to do with China. And China knowing in December that they had a virus, that they had a problem, knowing that China has lied to us, they have hidden information, they have not been forthcoming, they did not make the viral sample available to us in a timely manner, and that lack of transparency is something that they point to, and they say, we are all in this fight together, and we want to make certain that China does not have the ability to take down our economy or take down our healthcare system. And it is one of the reasons, two of the provisions that I have that will come before us are provisions that are focused on, one is on bringing our production of pharmaceuticals back to the United States. Senator Menendez has joined me in this provision, and it is the SAMC bill, Securing America's Medicine Cabinet, the SAMC legislation. What this would do is incentivize returning pharmaceutical production to the United States, allowing our colleges and universities to access funds from a $100 million grant pool to partner up with pharmaceutical companies so that we never find ourselves in the position of not being able to get the active pharmaceutical ingredients, they're called APIs, those ingredients that are necessary to make vaccines and antivirals for viruses like the COVID-19. And right now, China is saying they may not let us have one of the products that we need. And we commend our scientists and our companies and people like the Denison Lab at Vanderbilt University for the work they're doing to find that vaccine, to test that vaccine. We commend these labs for the work they're doing to find the right antivirals to help people fight this so that we're able to slow the growth and we're able to cap the growth in this. Now, we know also that as we go through this, telehealth is vitally important. This is something that I have discussed. As you know, Mr. President, I've discussed it with our conference, I've discussed it with the White House, and with the President and the Vice President, and I'm grateful to see the changes that we have in telehealth that is making it more available. I was talking with a physician from another state, not Tennessee. I was talking with him yesterday, and he said, well, our insurance company, which kind of is the only big insurance provider in this state, had decided they would allow telehealth through the end of the month. It is vitally important that we move these medically complex patients and elderly, especially elderly who have comorbidities and have complex medical situations, to telehealth. And it's important that CMS provide specificity and clarity on how this is going to be paid for these Medicaid and Medicare enrollees. We commend CMS for moving forward through the 1135 waiver system, that section of the code with Medicaid, for making some adjustments, but it is imperative that for these private insurance companies that we allow more specificity so that we can utilize that. So we have a situation. We know that this virus came out of Wuhan, China. We know they knew about it in December. We know that the rest of the world found out about it about 6 weeks later. We know that it has caused a global pandemic. We know every life is precious, and we grieve the loss of those lives, the inconvenience, and also the loss of the ability of so many people to have their businesses and be able to run their businesses, and families who are not able to experience what they had planned for this year. So we know that we are going to be working ahead. We're going to stay here, Mr. President, until we get much of this addressed and answer some of the questions that our constituents have. We do know we've done some work, but there is a lot more work to do, and we fully realize we can rise to this occasion. I yield the floor.
Mr. President.
Majority Leader.
We continue to work on the next bill, which generally referred to as Phase 3. This will be needed to respond to the crisis, and the Senate's going to stay around until we finish the bill and send it over to the House. I recommend senators stay close while we don't know exactly how long it'll take to get this done. Everyone knows that we need to do it as quickly as possible because the situation demands it. So we'll keep senators posted. I hope they don't go too far away. Now, Mr. President, I ask unanimous consent that when the Senate completes its business today, it adjourn until 12 noon, Thursday, March 19th. Further, that following the prayer and pledge, the morning hour be deemed expired. The journal of proceedings be approved to date. The time for the two leaders be reserved for their use later in the day. Finally, that following leader remarks, the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
So if there's no further business to come before the Senate, I ask it stand adjourned under the previous order.
Senate stands adjourned until noon tomorrow.